All right, let's go ahead and start the California Acupuncture Board meeting. Today is Thursday, March 26th of 2026. We are at the 2005 Evergreen Street, room 1150 A and B, first floor hearing room, Sacramento, California, 95815. And we also have WebEx going on. Let's start with roll call. Dr. Yangping Chen. Thank you. Francisco Kim.
Here.
Gregory Leon. Dr. Shudong Li.
Here.
And Mr. Ruben Osorio. Excellent. Thank you. We have quorum.
Thank you. Thank you, Yobadia.
Welcome.
So good morning, everybody, all the board members, legal and staff, and stakeholders. Welcome to the board meeting. Today is March 26, 2026, and we are going to have a one-day board meeting. We have afternoon meeting as well, so if you can, just stay till afternoon. So especially people from, I saw in the room, some stakeholder from Southern California come over. So also a lot of stakeholders on WebEx, and they stayed with their job, working, and participate the board meeting. It's their time and energy and passion, care about the board business and the professional business. So I want to say heartfelt thank you to all of you. So now we start with the agenda 3, review and possible action on board meeting minutes for November 6, 2025. So here put my name Chen. So my name is Yongping Chen. I'm the current board president. Thank you.
Any questions or comments from board members regarding the meeting minutes? If none, is there a motion on the table, on the floor to approve the minutes?
I can make a motion to approve the.
Thank you, Vice President Kim. We have a motion to approve the minutes. Is there a second?
I'll second.
Thank you, Member Leon. We have a second. Public comment? Seeing none in the room, let's turn to WebEx.
Thank you. If any member of the public would like to make a comment, please raise your hand by clicking on the hand icon next to your name, or if you've called in, pressing *3. We are displaying instructions and we'll give you a moment. All right, I do see a raised hand, and just a reminder, you'll have 2 minutes to speak. I'll give you a 30-second warning. And Margot, you should see a prompt to unmute yourself. Go ahead and click on that. All right, Margot, we will try. Oh, there you go. Margot, you are unmuted.
Great, thank you.
Uh-huh.
You're hearing me clearly.
Yes.
Great, thank you so much. And you'll let me know when I can start?
Oh, you can start now.
Oh, I'm so sorry. Okay. All right. Good morning. My name is Margot, and I'm a resident of California, Oxnard. I'm a 58-year-old disabled Gulf War Navy veteran and a patient who has relied on acupuncture as a part of my comprehensive medical care for over 30 years. I'm present today in strong support of raising educational and enforcement standards for this profession. On-
Point of order, it sounds like this comment doesn't have to do with the minutes. We are only taking comments as it pertains to the minutes from the last board meeting. You
My
can provide your
apologies.
comments during the education discussion items or the legislation bill or during the public comments for items not on the agenda if it does not pertain to those.
My apologies.
Certainly.
All right, no worries. And I see no further requests for comments. So Madam President, I return the floor back to you.
Thank you, moderator. Let's go ahead and take a roll call vote. The motion on the floor is to approve the minutes by Vice President Kim, seconded by Member Leong. Let's start with Dr. Yongping Chen,
Yes.
Francisco Kim,
Yes.
Gregory Leong,
Yes.
Dr. Shudong Lee,
Yes.
and Ruben Osorio. We have 5, 4, 0 opposed. Motion passes. Thanks so much, members. We will now, President Chen.
So next item is professional association update. Oh, it's the corner, sorry. The number is in the corner, I didn't see. The item 4, update from the Department of Consumer Affairs. Thank you.
Good morning, board members and staff. My name is Lucia Saldivar, and I'm the Deputy Director of Board and Bureau Relations at the California Department of Consumer Affairs. Thank you so much for the opportunity to provide a brief update from the department. Firstly, we are excited to share that Chief Deputy Director Christine Lawley has been named Acting Director of the department. She enters this role following the retirement of Director Kimberly Kirkmeyer. Acting Director Lawley brings extensive experience to the position, having served in multiple leadership roles within the department since 2013. She will lead DCA in this position until a director is formally appointed by the governor's office. Shifting gears here, last year, Governor Newsom took action to assist licensees affected by the Los Angeles fires and swiftly issued an executive order to allow a 1-year postponement of license renewal fees that were due for renewal between January and June of 2025 for survivors impacted by the fires. In January of this year, DCA began sending notices to licensees who chose this postponement option, with a reminder about the 1-year postponement and renewal fee due dates. Licensees with license types in the BREEZE system, can pay these license fees through their online account. Those with license types not in the BREEZE system may submit their payment via mail. Also last year, Governor Newsom's proposed state budget included a proposal to split DCA's oversight agency, the Business, Consumer Services, and Housing Agency, into 2 new state agencies, which would be the California Housing and Homelessness Agency and the Business and Consumer Services Agency. After public hearings and review by the Little Hoover Commission and the legislature, the governor's reorganization plan was approved on July 5th, 2025. The new Business and Consumer Services Agency will be responsible for consumer affairs, licensing and enforcement, and the Department of Consumer Affairs, which will be one of the 8 departments in this new agency. The 2 new agencies will officially become operative this year on July 1st. And DCA continues to participate in multiple agency work groups on the logistics required to transition the new agency, and we will continue to keep the board and bureau leadership apprised throughout the months ahead. Next, to best serve the public, it is incumbent upon all of us to ensure that we are being fiscally prudent in our decisions, especially when it comes to traveling for board business. So DCA would like to remind members and staff to book their travel far in advance to secure the best rates and evaluate if a rental car is always necessary versus ride sharing. Also, carpooling is highly encouraged when renting vehicles. We know that there are many new travel costs that some board members are experiencing. So this includes, for instance, baggage charges. So please keep receipts to ensure that we can get you reimbursed. Also, some training updates for board members. DCA's training unit has developed an unconscious bias training that's specifically for board members. And this training has been added on members' learning management system, also known as LMS. And it's incorporated into the onboarding process now for newly appointed members. Another reminder about board member orientation training, also known as BMOT, and that is an all-day virtual training that DCA will offer next week on April 1st, also on June 24th and October 21st. This training must be completed by members within 1 year of appointment and reappointment to the board. So please register for the first available dates so that you'll be in compliance. And members can register for BMOT using LMS. But if you need assistance accessing these trainings, or if you're unsure whether you're in compliance, please contact us at memberrelations@dca.ca.gov. And to close, thank you all so much for what you do to protect California's consumers. I'm available for any questions.
Thank you very much, Ms. Saldiva. So first of all, congratulations for Ms. Lally to be the acting director of DCA. We are under new leadership. We have working with Ms. Lally for a number of years, right? And she always is her leadership, we all appreciate. And the second, the LA wildfire happened, and the DCA has quick response and give some relief. And I think a licensee appreciate. And the third one about the board member training, I really want to appreciate. It's so available multiple times a year, and always a reminder us again. So make sure we all comply. So I, as board member and the president training also very, very helpful because the board member changing and something new and always need to learn. And I found each time the training actually little different and then always learning new things. So really appreciate. Thank you.
Thank you.
Any other questions or comments from the board? We'll go ahead and open up for public comment. Anybody in the room? Seeing none, let's turn to WebEx.
Thank you. If any member of the public would like to comment on agenda item 4, update from the Department of Consumer Affairs, please raise your hand by clicking on the hand icon next to your name. Or if you've called in, press *3 to raise your hand. We are displaying instructions and we'll give you a moment.
And as a reminder to our possible public commenters, this would be pertaining just to the DCA update. Thank you.
All right, I'm seeing no requests for comment. I return the floor back to you.
Okay, so now we go to next item, professional association updates. First, Council of Colleges of Acupuncture and Herbal Medicine. And I want to emphasize this is from outer state, so not in California, but this is like the name Council of Colleges of Acupuncture and Herbal Medicine. We really appreciate. Is it come? Oh.
The presentation will be for CCOM, California Council of Acupuncture and Herbal Medicine. Sorry, the Council of Colleges of Acupuncture and Herbal Medicine. There we go. Thank you.
Okay. We appreciate their efforts to present, to update their business on California Acupuncture Board. Thank you. Please.
Hi, everyone. My name is Dr. Thomas Kuo, and I'm the president of the Council of Colleges for Acupuncture and Herbal Medicine. We are a membership organization of the accredited acupuncture colleges from across the country, including 9 campuses from California, I think 7 schools, 2 having multiple locations. We do also have applications in from additional accredited schools in California that are going to be joining us as well. So I am a current licensed California acupuncture license holder that currently living in New Jersey, running an acupuncture school here. really like to thank the California Acupuncture Board members for having us here today and allowing us to update you as to the things that we are working on, the things that we are facing, and some of the ways that we are advocating with and on behalf of the profession. What we hope to present today are talk to you a little bit about our organization, our strategic plan, some of the things that we are working on, such as responses to the One Big Beautiful Bill committees that are the rise of the head committees that are affecting our profession and our schools. Talk to you a little bit about our spring conference and our CNT, and do a little bit of our legislative overview with you. What I hope we are able to convey to you today is really the need for us to really keep up with the demand for our medicine in all areas of our expanding clinical practice settings. There is statistically a slight contraction of our profession in terms of graduates coming into a profession, and of course professionals that are either retiring or moving on to different things. And while we have had a steady decline in enrollment in our schools, it's really important for us to stay competitive when we look at the other medical professions for us. And so what our schools face at this time is with the knowledge and agreement that all of our schools and profession in general are fully in favor of both financial and academic accountability, that the quality of our professionals is of the utmost importance to us. And in these discussions now, we're really looking at a couple things. How to do that. And so our looking at efficient ways to teach, different models, making sure that we can stay competitive in terms of the length of our programs, in terms of the cost of our programs, the financial burden of our graduates post graduation as they assimilate into the profession. And so these discussions are right at the top of our agendas, trying to find the ways that we can, first and foremost, protect the integrity of our professionals through our academic programs while making our profession competitive in the medical education market. So with that, I'm going to introduce my colleague, our executive director, Kristen Rickheimer, for our council, and I think she will go on to talk about a few of those things that I mentioned, and I'll probably come back and talk to you a little bit. Kristen.
All right. Thank you so much, Thomas. And thank you so much to the California Acupuncture Board for the invitation to present some of the activities of the council. Next slide, please. So in last year's update, we provided some, general updates about the council, and this time we thought we would just include, sort of some of the activities that have gone on since then, and provide some additional updates. One is just to highlight our virtual spring conference. As you may know, the council meets fully as a full council officially twice a year, typically in the spring and the fall. And this meeting will be April 22nd through the 24th. And we have educational sessions, we have committee meetings, we have our general business meeting for official business, and we also have a multitude of discussions on these issues that are currently impacting the profession, the council, and our member schools. Just highlighting a couple of sessions for our conference this year, or this spring, is a practical session on AI for faculty and administrators. The presenter is just a really engaging presenter with a multitude of comfort levels with AI, and he's been working in education for many years, and we're looking forward to bring him to the council members this year. In addition to that, Marilyn Allen, who I'm sure you all know, will be speaking to our members about the WHO's International Classification for Health Interventions, which of course is so important and timely, and she'll talk about the impact on schools and what they need to know. Next slide. Just some additional updates. The council, we've been trying to, or we have been increasing our communications and keeping information regularly flowing on the homepage as things are occurring within the profession. And within the council. So if you're not a member school and ever interested in what is going on, you can usually find some of those updates and announcements on our homepage. In addition to that, we do have for our member schools an internal collaboration portal that also has regular and timely updates both from the council and from partners and other news impacting the profession. You'll see our social media feed. We have invested a significant amount to support our member schools and support information about the profession through Instagram, Facebook, and LinkedIn. And we certainly encourage you to follow our channels there, but there's a taste of that on the homepage. I'll talk a little bit more detail about our strategic plan and the key priorities for 2026 within that strategic plan. And then, as Thomas mentioned, with everything going on with the federal policy and legislative advocacy in response to the One Big Beautiful Bill, we've updated a dedicated page on our website for some of those activities with regular updates. And again, we have some internal discussions for member schools as well on the collaboration portal. Next slide, please. So onto the council, the strategic plan. The plan had been in development for some time and was approved in November 2025 at the council's fall conference. It is to advance educational excellence and create new opportunities, we hope, for internal and both external collaboration, and really to amplify the profession's voice. The top 4 priorities, there were 9 strategic priorities identified overall for the course of the 3-year strategic plan, but you'll see the top 4 here. Strengthen and improve public-facing identity for the profession, advance educational excellence through nationally aligned competencies, develop consortium approach for supplementary topics, and expand legislative advocacy and regulatory engagement. So some of what Thomas was talking about, increasing that efficiency for schools, cost efficiency for students, are what these top 4 priorities are particularly aimed at, while improving the quality of education for our for those students. The plan also has some additional success factors, so sort of foundational elements that underpin all of the strategic work, and that includes just strengthening the membership value and engagement, providing that tangible value and continuous engagement for our member schools as they're facing the same challenges in the environment for healthcare, education, and higher education today. It reinforces the strength of our Clean Needle Technique program and leading the nation in acupuncture safety, and continuing to provide investment and support for the CNT manual, course, and exam. Also just continuing to invest in our technology infrastructure and continuing to build on our AHM coalition. You may be aware of the Acupuncture and Herbal Medicine Coalition, which has been established over the past few years, started with the 4 standard-setting bodies, national standard-setting bodies of ACOM, what's now NCBAHM, the Council of Colleges, and the ASA. And then we have in the last year added the Acupuncture and Herbal Vendors Coalition as additional nonprofit organization as part of the AHM coalition. So as Thomas mentioned, both the council strategic plan and everything that the AHM coalition and the profession is facing really will take everyone working together for solutions to support the profession moving forward. Thomas, any additional comments on the strategic plan?
No, I think you covered it well. I think, ultimately, if we look at the four strategic initiatives that we have here, ultimately it comes down to really, the acknowledgement that the time now is for the unification of our profession, and by that that we can face the public and with a high quality unified standard in the areas that define what our professionals are doing out in the medical world. So but we can move on and then we'll get back to this.
Okay, thank you so much. Next slide, please. So I wanted to take a few moments just to provide a brief overview on the Department of Education negotiated rulemaking process. I'll just spend a couple of moments. We did recently have a AHM Coalition town hall last week. If you are interested to learn more about this process, you can find that recording on the AHM Coalition website, which is ahmcoalition.org. But I did want to cover it briefly because it will have such an impact on the schools and on the profession. So as Thomas mentioned, the One Big Beautiful Bill Act was passed in July of 2025, and there were several provisions within that bill that are will have a significant impact on higher education. It's a little bit small text on the slide, but you can see under that negotiated rulemaking for higher education 2025, this is a process where the Department of Ed and other agencies within the U.S. government are, in some cases required by law to follow this process for, public input and register and provide notice, and to have some public negotiations in some cases regarding the development of new regulations or revisions to regulations. Typically under negotiated rulemaking, the agency will work to develop a notice of proposed rulemaking, NPRM, and will work with representatives of the parties who are most likely to be impacted by the proposed regs. And so those meetings are, the representatives are called negotiators, and they'll be from the most impacted, fields or sort of constituencies. So in the case of, for instance, the RISE committee, which was focused on student loan eligibility, professional degree designations, there were representatives from public institutions, there were representatives from the lenders, representatives from business, from veteran loans, and they all come together seeking ideally consensus on these regulations. Now, in the case of the RISE and AHEAD committees and some other areas, they are required by law for programs authorized under Title IV of the Higher Education Act to engage in negotiated rulemaking. So 3 committees in particular will impact the higher education industry and AHM industry, the hardest as far as we're seeing, and that's the RISE committee, the one just below that, accountability in higher education and access through demand-driven workforce, PEL, or AHEAD committee, and then there's one coming up in April, which is the Accreditation, Innovation, and Modernization Act, or AIM committee. So just move on to the next slide, please. And this just gives a brief overview. There's been so much going on. Actually, the Council and the AHM Coalition have been participating in this process of public comment since I think April or May of last year, even prior to the bill's passage. So, there's a lot that's happened that isn't included here on this slide, but I think it's important for people to understand sort of where we are at the moment and, what, issues are on the table. And so again, this RISE committee was focused on the program, student loan eligibility, and degree definitions. This is one you may have heard about, and it received some significant media attention because it's impacting so many health professions as well as some other professions. And the issue here is they have narrowed the definition of a professional degree to be limited to only certain, primarily healthcare, but some other professions that would be eligible for higher student loan limits and are considered a professional degree and graduate program. So in this case, as Thomas said, the making this education affordable is the top of our priority, but it still makes sense to ensure that there's parity across these healthcare professions in terms of access to a higher student loan limit. The acupuncture and herbal medicine meets the technical definitions related to the length of study, the elevated study, licensure, and other provisions. But it's just when the Department of Ed has narrowed this list to only certain professions that many healthcare professions have been left out, including several nursing degrees, PT, OT, and others. So this public comment has actually closed on the RISE committee, and the council did provide a comment letter, so did the AHM Coalition, and then the council has also joined the Advanced Professional Workforce Alliance, which is a coalition of other primarily healthcare profession or professional organizations and education organizations to provide a public comment. And then there'll be some more legislative outreach in the future. For the AHEAD committee, this is the first session was focused on Pell Grants, and the second was focused on accountability and earnings metrics. And the AHM programs are facing a unique vulnerability, and this is within all of complementary medicine, that how this outcomes data is collected and how they've proposed in this new proposed framework and compared across the fields. So this one is particularly challenging, and looking at our graduates who are typically not W-2 earners, they're self-employed, and how the IRS is looking at that earnings data rather than something like potentially default rates and other metrics that could be more favorable. In this case, the council has submitted comments during the committee. There's a public comment open now, but it's only for the workforce Pell portion, not for the earnings and accountability portion. And we do expect that to open in the future. A couple of things as to how they're looking to evaluate these programs. Again, I won't go into detail, but this is what was previously called gainful employment. And in observing the committee negotiations for this AHEAD committee, what they were striving for is a single framework for all of higher education and not looking for any carve-outs for any specific profession. And so, and to try to avoid that, political whiplash or ping pong when the administrations would change and maybe different metrics were applied. So this is one that is, again, of critical importance for the profession to come together, for, between schools, professional organizations, state associations, and all of us to work together, because there isn't a single solution that's going to, create that best path forward, increase earnings, and potentially decrease costs for the schools. Just number 3 on this slide is the AIM committee coming up focused on accreditation. That's certainly something that ACOM will be following closely and has been already. That session is scheduled for April 13th through the 17th. And just like other negotiated rulemaking processes, you are able to register to attend those sessions virtually or in person. So again, there's so much to cover, but I think with that, I'll turn it back over to Thomas to talk a bit about our clean needle technique and some other commentary.
Yeah, I mean, just before I talk about that, just to kind of continue with what Kristen is saying, you know, with the RISE committee and looking at the access to the higher or lower tier of Title IV funding, we're not. I think the discussion is access, whether or not access to higher or lower tier is going to end up becoming a barrier for potential students to enter into our programs. We are recognizing that with the AHEAD committee, that looking at the metrics in which they are measuring gainful employment, that the answer is not through increasing debt. And so we have to be really careful about creating situations in which we create further, our metric becomes further. We're looking at a significant difference in the data for our graduate earnings, those who are W-2'd, and what it needs to be in order for us to pass that metric. As it stands now, it just does not seem possible for us to pass that, even if we were to double the time in which, you know, because we had looked at perhaps the timing of the measurement is not to our favor, which makes a lot of sense because our model of education is different than many. And yet when we look at that, we are so far from that likely is not the answer. And so I think, again, we come back to the idea of efficiency and the reduction of student debt while increasing the quality of education, which is a very, very hard task to do. And that is something that, of course, we are working on. We hope that we can unite the profession to find that solution, because it is a difficult one. Now, we did get a chance to go down to Washington, D.C., meet with some lobbyists, and what they told us, so again, not definitively, is that what our council, of course, is concerned with is the negative ramifications that this rulemaking may have on the fate of our schools, including our California schools. With the upcoming accreditation scrutiny coming, obviously, what lack of Title IV or taking Title IV away from our institutions doesn't necessarily mean that schools will close. However, what they suggested to us, that they heard from meetings on the Hill, was that the squeeze was going to come down on accreditation. And essentially saying that if schools do fail the metric 2 years in a row, the first one being measured in 2027 and then in 2028, that if they do fail 2 years in a row, Title IV is removed, but also the thought is that there'll be pressure on accreditation to essentially close down those schools. So that is something that we are looking at as a possibility. This is why this is an extremely existential threat to our to education, but also the entire profession on the back end. So so with that good news, I will move on to CNT. CNT is I just got back actually last week from a accreditation site visit from a California school, and very, very happy to report that it is one of the California schools, one of several California schools that does require the Council of Colleges CNT course and certification for their institution. CNT clean needle technique is probably, as you know, the national standard in terms of safety, which is, of course, a really important public face that we need to present as we present our profession to the to rulemakers who aren't necessarily familiar with our profession. And some that may not necessarily even believe in our profession. We have to safety, having a common standard of safety is extremely important for us to be able to move forward and create a more positive work environment for all of our professionals. Our course in CNT is standardized. It has been the psychometrics review and has gone through a rigorous review process. Continues to do so, and and California schools, whether or not they require it, most of them are teaching from the CNT materials, and again, so we are hoping that we can impress upon you to consider also including this as a requirement in California. Again, standardizing it across the entire country. Therefore, we will be able to use that to show that our unified profession does have a standardized set of safety standards for the safe practice of our medicine all across our country. Do we want to move on to the next slide, please? Thank you. So here's a little bit about our, I actually can't see it, it's too small, but this is information about our Clean Needle Technique program. This is the only program of its type. It is a protected, copyrighted, trademarked program, which includes the term Clean Needle Technique, as well as all the materials that are on that are associated with our program. Let's see, anything, Christian? Anything? I can't see what it says.
It was just the overview really from our website here, and I think you covered the top items, and then yeah, it's just the overview from our website. All the information is there about CNT and the review course as well, and that's pretty easy to find on our website.
Yeah, and I graduated from a California school, and when I graduated years ago, but I graduated, my school also required the Council of Colleges CNT course, and again, I do know many of the California schools do require that. Can we move on to the next slide, please? So we would love to request that California and your board do consider making the Council of Colleges Clean Needle Technique a requirement for licensure in California. Again, as you see, we have several reasons. We just threw down a couple here. We have verified competency assessment. So we do have an exam that is both written and practical. These exams also have gone through much review. We have done them both in person as well as online. Both of them have gone under review. So for both convenience of instruction as well as the assessment, it is administered in both of those ways. We have alignment with national licensure expectations, as well as strengthens the public trust and professional credibility, of course, as the most important public face we probably have is to ensure the safety of the public that we are treating. So so with that, I think I'm going to hand it back to Christian, or can we go to the next slide, please?
Sure. I think the next slide just clarifies a little bit about the trademark and copyright, and I'm happy to cover that. Just a reminder that Clean Needle Technique, the term, and CNT are both registered trademarks of the CCAHM. The CNT manual is copyrighted. That information is all pretty prominent on our website. And just to clarify, the manual is available for free to to everyone, and we want that to be, of course, the resource in the standard. So schools can absolutely teach needle safety, infection control, everything based on the CNT manual, and prepare students for the official CNT course and exam, and reference CCHM CNT as the national standard. Just a reminder of what is, by trademark and copyright law, schools can't use CNT or clean needle technique for internal resources if they're not referencing the CCHM material and course, and aren't allowed to reproduce or distribute CNT manual content. Obviously, what's available online, we want you to reference it. We want you to use it. You just can't edit, change, and use it on your own. And cannot represent students as, CNT certified without the CCHM official certificate. So I think we just wanted to provide a little bit of information there. And then back to Thomas for any additional commentary.
No, I think that you covered it well. I think it's just, we just want to make sure that, we do our part in terms of trying to create a singular national safety standard that we can present to the public. It's really important. Obviously, California is one of our most, if not most important states in terms of representation for our profession. California schools, we are in contact with at least the council schools, and most of the council schools, or all the council schools that I've talked to, I haven't gotten around to every single one yet, are in favor of standardizing CNT as the national standard, including California, making it a requirement, and understands the reasons for doing so. And so we would like to just, again, request that the board consider making that a required certification for licensure. Move on to the next slide, please. We don't want to see this. Next slide, please. Thank you very much. We appreciate the opportunity to come in and speak with you and talk to you about our council, about what's happening, but also just to remind everybody about what's happening in our field and the pressures that we face, to publicly state that our schools, our council, are absolutely committed to the quality of our education, to the professionalism and to the knowledge, skills, and abilities of the graduates that we graduate from our schools, but to also acknowledge that it is not a question of necessarily more. It is a question of doing what we do better, more efficiently, finding a way to reduce student debt and increase the quality of the education of our graduates, so that we can remain competitive within the medical field, that our profession can thrive, and that we can move forward and grow throughout the country in all of the kind of expanding places, settings in which we are practicing, whether they be hospitals, VA centers, integrated medical centers, of course, private practice models that we are very familiar with. The medical field is changing, and we have to find a way to adapt. So thank you very much for this time. And Kristen, any last words?
No, thank you so much to the board again for allowing us to provide some updates, and we are available now and in follow-up for any questions and to continue the conversation. So thank you so much for everything you're doing.
Yeah, thank you.
Thank you, Dr. Ko and the EO, Christine
Rickheimer, but very close.
Rickheimer,
Yeah.
thank
Rickheimer.
you. I remember that. Rickheimer. Okay, thank you so much for this very comprehensive update. And we have not heard that update for a whole year. And this year, a lot happening. I can feel the whole profession's frustration, especially affected by the student loan cutting from the federal loan. So I want to hear the comments from our board member, vice president, and all the members.
Yeah, this is Francisco Kim. I'm vice president of the board, and also I'm chairing a education and license committee. I have a quick question. How many schools are in your organization? In how many states?
I would have to look up the states. It's at 32 member schools at the moment, and I think it's around 20 or 20, somewhere between 20 and 25 states. I'll have to look it up and I can get back to you.
Do you have a regular communication with the state board or agencies regarding your business?
We have communication with the state boards through our institutions. Our institutions maintain their communication with the boards, and typically we communicate through the boards, not typically directly, but through our institutions.
Okay, and then I have another question. Is CNT? I know a lot of states allowed PT and chiropractors to do the dry needling. Do they approve this CNT certificate program?
So in some cases they do. We have eligibility for others to apply to take CNT, but I don't know that it's necessarily in. I don't know the specifics of requirements in all the states.
Yeah, typically, dry needling statutes do not have a requirement for CNT, but certain PT boards do suggest the certification from the council.
They didn't approve your CNT program. They didn't require.
Yes, correct.
Your program, right?
Correct.
Okay. And then as a practitioner like you, Dr. Kuo,
Yes.
I've been practicing more over 25 years, and when was this CNT was patent or last updated?
CNT was last updated. It was last updated.
Yeah.
It is continually updated.
Yeah.
But we went through a full update. What, Kristen, was it last year or the year
Yeah,
before?
I think it's updated every year. Essentially, the editors are reviewing every year. I think the last full manual update, however, has been 5 years. I will double check on and get back to you on that too.
Right.
It was before my time for a full update.
Okay. And you think the CNT protocol is enough to cover the practitioner's safety practice?
Yeah, I think if you again, the manual is downloadable on our site, and if you go through the manual, looking at it, it basically covers every aspect of practice in terms of best practices, safety standards, and so forth. So it has been for decades and continues to be an expanding document in terms of setting safety standards for the entirety of clinical practice within what's under our scope.
Yeah, the reason I'm asking is I had the chance to discuss on this hands-on training issue with a professor from Korea.
Mm-hmm.
And then in Korea, there are a lot of practitioners are starting to use ultrasound sonogram for acupuncture point locations, and and here already studied for I see physical therapists. But as an expert, he said it doesn't matter whether you do you use the ultrasound or anything. You need to have a hands-on training first, locate and using the tools. So I don't know how much CNT is accommodating those issues, because we are not just dealing with needle, we are dealing with the actual person and patient. And so there should be another level of safety concern. So that's my concern.
Well, yeah, thank you for the comment. I think what we tend to do, we have an ongoing CNT committee that is looking at the job task analysis, both from California, from the NCBHM, looking at where our scopes are expanding, and what areas that need to be included into the CNT manual. So the CNT manual has grown tremendously through the years. I remember when I graduated, it was a very small book. It is now. We don't even print it anymore. It's too big. But looking at, for example, right now, acupuncture injection therapy is we are expanding into areas where we are now seeing our profession move into. Ultrasound is one of those areas that we have talked about in terms of looking at how prevalent is this, and who and where can we find best practices for this, and start to develop these kinds of practice guidance, looking at how to create evidence-based recommendations for any of these areas in which our scopes are expanding.
Okay, thank you. And my last question is, what do you have any data for, like this is a question for gainful employment. Do you have any data of those graduates in California or in your schools in different states, employment rate?
Employment rates are usually they are gathered usually for, I believe, like you have graduation rates, you have employment rates. These are, I believe, gathered as part of IPEDS. Now that is a voluntary reporting. So the actual validity of those is, it's not exactly the correct data, but we do have that data, or institutions have that data in terms of graduate reporting. We do have state by state, institution by institution reported income levels as well. So we do have a lot of data that we are using. The data that has been examined is basically informed us in terms of where we stand in terms of gainful employment, which unfortunately we don't stand in a very, very advantageous place.
Thank you.
Yeah, thank you.
Thank you, Vice President Ms. Kim. Other board member, public member. Okay, so thank you very much for some question I want to ask. You already asked. Thank you. So this report is so comprehensive. I'm really impressed, and I can see you are doing numerous job and very busy. But my first question is, I have a lot of questions. I try to be short and ask most, but I wonder, I saw the website, CCOM is 51c3. So the member is association, right? Members. So you said 32 members right now. And members pay membership fee. So other than that, do you have any like donation or some, I mean, membership fees, like association membership fees, not much. How can you hire such a very effective EO to know so many and manage CNT? Of course, CNT is that's income too. But I said, do you accept some donation as well? I'm just curious.
Well, thank you so much, and I appreciate your comments. We so CCHM is actually a 501c6, so it's actually still a
Oh.
nonprofit organization.
Oh.
It is a nonprofit, but it's more like a sort of a trade association. We are a membership organization. It just has some where a 501c3 is tax deductible for the an individual who donates. A 501c6, someone could donate, but it's more like a business deduction or something like that. So the council doesn't really have a mechanism for individual donations. Financed primarily through the CNT and membership dues.
Thank you, because I saw you do so much work. So I heard, yeah, so about CNT, I want to continue the question because for safety, it's really, really important for this profession to be even in practice. And safety also based on understanding the contents. So in California, like Dr. Kuo, you graduate California school, you are, I assume your ethnicity, right? Maybe Korean or so
Chinese.
some Chinese?
Mhm.
Oh, okay.
Well,
Cannot tell. Cool. Okay. The language, I think in California is like a very diverse.
Mhm.
And how do you accommodate the different language as their first language? I mean, those people, English as second language, about 30 to 40% of licensee or students in California, their English is not a primary language. So how make them understand? How many language do you provide for the test?
Well, thank you for that question. We have in the past, we have offered the CNT course and exam in both Chinese and in Korean, and of course in English. We have discontinued the Chinese and Korean only because we did not have enough applicants for that. So we do have the infrastructure to offer that again. We have discussed internally that, should California come on board, that likely is something that we would have to return to because of the demographic of California. Obviously, large Korean and Chinese populations, as well as schools offering in programs in those languages. It is important for us that if language is a barrier, that we offer those programs and exams in those languages, which again we do have the infrastructure for, because we have offered that in the past. I think we just discontinued it pretty recently. So reestablishing that is actually something that we probably would expect if California does come aboard on this.
Okay, that sounds
Yeah.
more practical. More people were willing to take the test.
Absolutely.
Thank you for. So you update every year. That's impressive. Okay, so my personal one suggestion is, because I saw all the the student or license, when I saw them, they use the hand to pick up the cotton or cotton with the alcohol. So I was a surgeon in China for 2 years. And after I graduated from Chinese medical school, after 5 years education, I just assigned to that department. And I probably just have the habit to use forceps. And use forceps to do cupping. The alcohol is far away from your hand, and the cotton will not. The alcohol. I mean, we emphasize washing hands, but when you pick up cotton, dry cotton or wet cotton, use hand. Sometimes after treatment, the patient may have some blood and use the hand. It not good for not safe for the practitioner. And some people, they have AIDS. If I have patients who have AIDS, of course, they declared. But I cannot prevent, like after the needle insertion or pull out, no bleeding at all. So I just have habit. When I saw students use the hands, I was so surprised. But all of them, they told me, even I told them, suggest them they will not change. So we are used to it. So I wonder, could that be improved? And use especially use the wet cotton to wipe the skin. And I think it's better we use a forceps. It's just the habit change. So
Well,
that's my little suggestion.
Well, I absolutely agree with that. I think, first of all, that using the hand would be a CNT violation. But I think that, one of the things that I want to, make clear is that, we have California schools that are part of the conversation and the development of the CNT. We, if California comes aboard, we not only welcome, we implore that we have California input into the development as we continually expand and develop the evidence-based regulations that we have in CNT. That these conversations will include people like yourself, and that we can grow from your experience and your wisdom, and that we can kind of shape this national standard that is not something that is from us, for us. So that is absolutely the intent, and so welcome your input, and of all of our colleagues in California, many of whom are on the council and do input into the development of the CNT currently. So yeah, absolutely agree with you.
Thank you. And thank you for recognizing California's voice is important.
Well, absolutely.
So, I don't know how many California schools are your member?
We have nine members, 7 schools, 2 of which have 2 campuses right now. So we have 9 campuses. We do have a couple in application to return to the council as well. So we're looking at about probably in the vicinity of maybe 11 schools or so.
Okay.
Kristen, I believe, is that correct?
That sounds right. Yeah.
Yeah.
Okay, thank you so much. So I want one more point is, I know this profession right now is more stressed out, frustrated than ever. So gainful employment rate has been challenged. I heard from the stakeholder, even from the online, like the Facebook. Some people posted from school. I read that. I understand. And now the loan problem. So have you looked deeper? What's the cause of the problem? For what I understand is, my understanding for the several, like the whole system, number one is education. So education quality, like you said, efficient. I appreciate you said efficiency. I like to hear more detail from your next or maybe private conversation or board. So what's the measurement for improve the efficiency? That's really the key, I think. Hours is 1 hour. So your efficiency based on hour. Without hours, certain hours, a proper hour, you cannot make efficiency. So they work together. So how to balance, I think, really need a conversation in the profession. And then number 2, of course, you have to be capable, right? Competent. So what is competency? 24 years ago or 50 years ago, competency, and today, the competency should be the same or we should evolve. So this is the one from ourselves. We have to improve ourselves to get recognition of the public, of other healthcare profession. So number 2 is the employment. Who would hire acupuncturists? Hospital, medical center, why they don't hire acupuncturists, right? And the third is insurance. Insurance recognition. I think this is a huge part. The student, like you said, student, even they spend hours, spend money to get a license, and afterwards nobody employ them, and the insurance does not pay them. This is really hard. I'm practicing. I'm practicing 22 years here, 18 years in China, and I can tell China single pay, no problem. Herbal, everything covered, as same as West Messi. So I will ask, is CCOM has any position to help this part, to like educating, like Medicare? Medicare, the bill introduced by Congress member Judy Chu for 10 years. But like this year, I think right now, 17 co-sponsor. So you have so many schools, all students write a letter to their own Congress member. And this is a nonpartisan bill, Republican, Democrats. If each state, student, school can write a letter to their Congress member and promote the Medicare to include, we are the only one to single out, not in Medicare system. It's embarrassing because the patient now come to the acupuncturist say, I have Medicare coverage. Why you don't accept it? You don't take my Medicare. We have to explain, spend a lot of time. So I don't know if the CCOM's position can do this, but I hope you can do something to like in big area, the whole country to promote this profession. So California, your national organization, all work together. So as a profession, I just ask this. I have more questions. I stop here because of time. Okay, thank you so much again. And we open comment to public, right? Oh,
If I may recommend that we leave public comments to the end of this section, as we have several other presenters waiting to present. And we want to be able to have the board ask their questions first, and then public comment can be provided afterwards, if you so choose.
Thank you for all clarification.
Okay.
Okay.
Thank you.
Thank you, Drs. Kuo and Director Rickmeyer. Pleasure to see you. Our next presenters are the Accreditation Commission for Acupuncture and Herbal Medicine. If you give us a moment as we load their presentation up and pull their speaker to the panel. Today we'll be hearing from Dr. Mark McKenzie, Executive Director for ACOM, and Jason Wright, the Director of Accreditation.
Good morning.
Good morning.
I'm trying to get my camera to pop on, but it doesn't seem to want to do that. Tell you what, let me just go. Good morning.
Whatever you're comfortable with.
Yeah, good morning. My name is Mark McKenzie. I'm the Executive Director of the Accreditation Commission for Acupuncture and Herbal Medicine. And with me is Jason Wright, he's our Director of Accreditation. Dr. Chen, I'd like to thank you for the invitation and the rest of the board members for inviting us, and Executive Officer Bodia. We've had a long working relationship, so look forward to continued collaboration. And as we go through this, we're going to cut our presentation down a little bit because some of it is duplicates some of the things that Kristen and Thomas shared. So there's no I don't think there's any need to rehash that, but we would like to make sure that we get your questions answered. If you could go to the next slide, please. The commission is an 11-member commission, and we've had at our February meeting that just ended on the 25th of February, we had some people that rotated off, and we have some new individuals. These are our current members, and there are 2 open administrator positions that we're actively seeking new individuals for. Let's go ahead and go to the next slide. To give you just a quick snapshot of the profession, we've got the current commission staff, which is a 5-member staff, and I've been there since 2012, and I was actually on the commission in 2008. Jason, Carl, and Mike have all been there since 2016, and Amos has been on full-time for the last 2 years, and before that as a contractor. Next slide, please. We keep a dashboard that kind of updates folks, that we share this with the council, and we will share it obviously with you. So, and I think that this addresses some of the questions that came up previously. So there are currently 45 accredited institutions. 31 of those 45, ACOM is actually the institutional accreditor, which means we also have oversight over their access to federal student aid. And 14 of the institutions, we are a programmatic accreditor. They would all have another institutional accreditor. There are a couple of California schools that are similar to that are where we're the programmatic accreditor. That's a reduction of 3 institutions in the last year due to closures and or removal of accreditation. As far as total accredited programs, currently we stand at 113, and you see the distribution there. That's down a couple of programs from last year. And then currently, of all the programs we offer, everything's offered in English. We also have 13 programs offered in Mandarin and 7 in Korean. There are a total of 54 locations because some of our institutions have multiple locations. And currently it says 22 states, we're actually down to 21 states. So the acupuncture schools are located throughout the United States, but primarily the largest group is in California, Florida, and New York, and then spread throughout. Next slide, please. Also wanted to share, this is total head count. So you can see on this graph, if you can read it, from 2013 to 2025, we track the unduplicated head count involved in the accredited programs. And so there was a pretty good drop, or fairly large drop between 2013 and 2016, 17, and then a steady drop to where we're just under 6,000 total students in 2025. It's a challenging trend, and there are multiple reasons likely for that. Higher education has gotten very expensive, and some of the other things going on. And of course, the COVID pandemic impacted a lot of the schools and the various programs that we accredit. Next slide, please. Ben had let us know that these were kind of the topics on your agenda. And just want to reiterate that ACOM is a 501c3, and as part of our bylaws, we're actually prohibited from lobbying on behalf of any state or federal legislation. So we can provide information to the board and the board staff regarding our requirements, and we can comment, but it's more informational rather than taking an active position. I know there's interest in moving forward with a doctorate degree, and which would be, I think, 3,300 hours if my information is correct, which is a significant increase from the current requirements that ACOM requires for the entry-level doctoral programs that we have. And I think as you probably gained from Kristen and Thomas's discussion, especially with the Department of Education information, there is a lot of scrutiny about the cost of higher education right now, and especially healthcare education. I sat in on the National Advisory Committee's meetings for the last 2 days, where the National Advisory Committee works with the U.S. Department of Education to consider and review accreditors. And there's a lot of change afoot right now for all higher ed, and it's impacting healthcare, complementary healthcare. It's definitely going to impact the acupuncture community. If the regulations that are currently proposed and/or in statute move forward, so we're going to have significant changes. I think on items B, C, and D, we're just going to hold off on those and address those as potential answers to your specific questions. If you could go to the next slide, please. I think it's important to understand that, over this last 5 years, we've all experienced this worldwide pandemic, years of associated economic and social disruption. We're in the middle of a deep demographic canyon with respect to university age students, and especially those for looking at graduate schools. And all of our programs are graduate, so master's degree or higher. We can do certificate programs and non-degree programs for students that are enrolled in a master's program at least. And then the regulatory conditions have changed at a far faster pace than most of us have ever experienced. That's especially true with the information Kristen was sharing about the RISE committee, the AHEAD committee, and the upcoming AIM committee with the Department of Education. It's public information that the Trump administration wants to dismantle higher education and the Department of Education. That's nothing new. And they are finding different ways to address that. And there is a high level of scrutiny right now on accrediting agencies and higher education. And so these regulatory conditions are really impacting all of us. The other significant factor, I think, is really the entire financial aid system through the government. They clearly would like to reduce the amount of federal aid that's going out to students, and especially in higher ed, graduate and doctoral degree programs versus bachelor degree programs appears to be a focus. So next slide, please. I do want to touch just briefly on ACOM. Like the schools we accredit, we have to go through a periodic review, and our oversight is with the Department of Education. So the NASIKI committee, which I was referred to earlier, is an advisory committee to the U.S. Department of Education. And every 5 years, we go through the same process that schools go through. We just do it with the Department of Ed and their regulations, 34 CFR 602. That process, we turned our initial petition in July of 24. We got an initial response or the staff analysis of the petition in September of 25. And we just turned in our, we were required to turn in our response to that staff analysis in February of 26. We are on schedule to be before the NASIKI advisory panel in July of this year. And then typically the decision of the NASIKI panel is made at that meeting. However, that an important piece is it's an advisory committee, so it's a recommendation to the Secretary of Education. And ultimately, it's the Secretary of Education that makes the decision as to whether they follow the NASIKI advisory committee panel recommendation or the Department of Ed's staff recommendation, and those can be different. There can be different recommendations. So I'm going to go ahead and skip the discussion on RISE and AHEAD comments because those have been covered. If you can go to the next slide. We've convened a working group within our organization that includes our standards and criteria committee and members of the profession, especially through the council. I'm going to go ahead and Jason, do you want to add anything specifically about the efforts of the working group at this point?
I have a few points to help with some of the questions that were asked to the council that I might have a little more thorough explanation for. So I'll just do them all at once rather than step in right now.
Okay, let's go ahead and go to the next slide. ACOM does collect annual report information from all of our accredited institutions. The previous slide that had the unduplicated head count was a 30,000 foot view. We've changed our annual report requirements. So our February data that came in that was due December 2nd has much more specific reporting as far as total head count for both full-time and part-time, regional distribution, Eastern US, Middle US, Western US. We are also comparing California versus everyone else and full-time versus part-time. So the preliminary results looking at that is, 41, 42% of the current head count in schools are students in California schools and 58 in the rest of the country. It also captures some information on international students and then student demographic distribution, program enrollment, and then graduation and retention by program. This is intended to give both the institutions and the state higher ed authorization organizations and specific boards more information for them to be able to do their work. Next slide, please. So I think I'll invite Jason to share his information at this point, and then we'll go ahead and take questions.
Thank you, Mark, and thank you to the board and to Executive Director Bodea for the invitation to participate with you all today. I wanted to come back to some of the questions that Dr. Kim posed to Dr. Kuo and the Council of Colleges. One question was number of California schools versus total schools, and Mark was presenting, how many the student layout percentage. But to that question, we have 11 schools in the state of California out of the 45 schools that are currently accredited by ACOM. We also have several eligible programs and institutions that are either operating within California or are opening programs within California that are in the preliminary stages of engaging with ACOM to see if they can achieve ACOM pre-accreditation for either the program or the institution and its programs. So there could be more California schools coming up soon. One of the other questions that came out was what sort of data are you using for gainful employment? And I think it's really important for folks to understand. And if we're referring to AHEAD and gainful employment and the new earnings metrics and thresholds, those are all I'm gonna refer to all of those as the same thing. The challenge that the profession is encountering right now is that AHEAD with its earnings threshold is in statute. And so it's very unlikely that the rules are going to change prior to them being implemented. They are gathering negotiated rulemaking. There is an opportunity for public comment. There is a slim possibility that they might change some things, but because it's in statute, it's not likely to change a great deal, if much at all. And the problem that we're encountering as a profession is that with our programs as graduate programs, as both master's programs and entry-level doctoral programs, we have an earnings metric that we have to meet that shows that our graduates, when they're 4 years out of the program, are making more money than the average bachelor's graduate is making either in that state or in the nation as a whole. And the problem with that is that the schools have no opportunity to gather their own data or to validate that the data that's presented to them is accurate. The way that is calculated from the department is they take all of your students that received some level of federal financial aid, and then they pull their income data from the IRS, and then they compare that against income data for bachelor's level graduates that's drawn from the US Census Bureau. And what we have seen so far for every institution and every program for which we have data available, none of the acupuncture programs will meet those metrics, and there's no opportunity to argue against that data. It's data that's given to us from the federal government, and there's no opportunity to refute whether it's accurate or not. So if things stay in place, it's highly likely you could see all of the acupuncture programs throughout the United States ineligible for direct federal student aid by July of 2028. So that's one real important take-home message. That's why, to Thomas's point about looking at efficiency of programs, one of the strategies is how can students afford these programs if they can't get federal loans? And could they afford them as cash-only payments? Could they afford them through alternate financing structures? Might there be state support for training programs? But that's the challenge that the schools are confronting. And then Mark asked about working group. With that, the standards committee for the commission is looking at, and this was a project that we were looking at prior to these gainful employment regulations coming into place. We were looking in particular at, are the programs right-sized for the training requirements to yield competent, safe, successful graduates? And so we're looking at the quantity of hours, how those hours are split amongst content areas in our current accreditation standards, and also changes and innovations with educational delivery to determine, do we need to be prescriptive in the number of hours? And if so, are the number of hours that we currently prescribe appropriate? Do they need to go up or do they need to go down? And now we're also looking at how much could we maybe remove some of those mandatory requirements to enable schools to do innovative program delivery and efficient program structure to try and minimize the cost for current students, especially since the loss of federal financial aid for most of our institutions could result in school and program closures. Another thing, because there's additional details about AHEAD and how they're doing those employment metric calculations, to Executive Director Bodea, Ben, if you would like the slide decks that came from the AHEAD Negotiated Rulemaking Committee, I can easily email them to you, and you can make them available for the board if that's something you're interested in.
Thanks, Jason.
That's all I have. Happy to field questions from here.
Yeah, thank you so much. Yeah, as Jason's pointing out or painting, it's a very sober time for this profession. And one of the things that it'll probably come up as a question, and I want to hit it right off the bat, is the earnings threshold, based on our understanding and our research, is a metric that was designed primarily to deal with salaried income. 70%, approximately 70% of graduates, according to at least the most recent National Certification Board's stats, 70% of our graduates are self-employed, and self-employed individuals typically submit Schedule C instead of W-2. And the Schedule C, for any of you that run your own businesses know, you take out all of the expenses on the front end, and the adjusted gross income is reduced because of those expenses. Where on a W-2 salary, that that is opposite. So right off the bat, my assertion and my concern is that the metric that they have decided on is a flawed metric that actually penalizes self-employment. And while Jason is right, is there's some statutory language that locks a lot of these things in, there are some challenges for the way the department has moved forward with this, and ACOM and not only our accrediting agency, but many accrediting agencies of other health professions are currently looking at this whole process and have significant issues with the way this has been moved forward. There I think there's pretty much universal concern from those as to whether this is a fair metric, and it clearly penalizes those that are in self-employment. So I think at this point we'll stop and take any questions from the board. And thank you.
Thank you very much, Dr. Mackenzie and Mr. Jason Wright. I think you both came last year, right? Two of you. Thank you
Yes.
for the update. So I will let other board member to make comments first.
Hi, my name is Francis Kim. I'm vice president of the board. Licensing committee. I think all the situation. Thank you. All you've been addressing is unfortunate, and then I see all other health professions are getting impacted. For example, I just learned that physical therapy board. If you go look at the California Physical Therapy Board, there are more and more of inactive licenses. Especially the younger generation, they're leaving their professions because of all these circumstances. So it's not just impacting acupuncture healthcare profession. We are talking about here today is not those circumstances, but we are focusing more on the quality of education to protect the service, protect the public. So my question is, you just mentioned that 70% of the graduates are self-employed, and maybe then counting unemployed will be much less. I mean, much more of what I'm saying is I contacted some of the schools and then asked them about their situation, and one of the school told me, 50% of their graduates are unemployed. And then what you're saying is 70% of the graduates self-employed. That those who are working in the acupuncture field is either full-time or half-time, and they don't make enough sufficient income, so they are leaving their profession, or they go in different field at the same time and work double shift, I guess. So what we are talking about here is not the circumstances of employment. I have studied that this income, gainful employment and an income status is determined by the market, not just by the insurance payers. So I don't know whether you have the other analysis on this declining number of enrollment and also those who are leaving the profession or those who are struggling to make a living using this profession's license.
Yeah, Dr. Kim, thank you for your question. I would like to see the information where 50% are unemployed. If you have a reference to some data that can be published, because like you, I hear all kinds of numbers put out there. This profession, and I'm looking at ACOM as well, as from a historical perspective, have not done a good job of collecting data around employment and self-employment. But what I can tell you is the most recent data that I'm aware of is from the NCB AOM or AHM now. It's their 2024 job analysis. What they indicated, and this was, I think there were 4,000 respondents or something like that. Based on the respondents, there were 31% of them indicated that they worked full time as in acupuncture practice. 42% indicated that they worked 20 to 40 hours. 21% indicated that they worked less than 20 hours, and 2% indicated that they were unemployed, and 3% of that were not applicable. They weren't providing either acupuncture or herbal treatments. So that's a limited, again, it's a limited survey, but it is the most recent data that I'm aware of. I do think it's a very challenging work environment for anybody that's in practice. I know when I was looking at their data, I think of the 31% that were working full time, it was between 60 and 65% of those individuals were making over $75,000 a year in adjusted gross income. So it's hard to do a comparison, especially with the information that we're getting from the Department of Ed, that gets information from IRS and Social Security, but we're not able to see it. That data is masked. We just see the final results because of the confidentiality. But it doesn't line up with the data that we have, and as far as what we see. Now, that's not to disparage or say that there aren't people that are really struggling to be successful in practice, because there are. I hope that helps answer your question, and if not, I'm happy to expand.
Thank you. My concern is this. So, like you just mentioned, that 65K income, which is under employed in California, unfortunately. But
just as a quick correction, it was 65% of the 31% work full time. Of that 31%, 65% of them are making in excess of $75,000 a year. I think it was 40%, roughly 40% were making over 100,000, and another 20% were making, or 20% of that were making over 150. So that, that's again, that's only based on the 31% that were working full time.
That's better. Okay. My concern is this. So 70% of the graduates self-employed, and I see there's some some of the market, especially the big employers like hospitals and big clinics. They are looking at some candidates for, they're offering a job, but not many of the graduates are fitting. So to increase the gainful employment rather than just self-employed, I would suggest you to increase the or parallel requirement for those who already finished their science requirement, so that they can finish their courses and then they can get get employment in big institutions. So that's my suggestion.
Thank you for that, and we'll add that to the list that we're trying to look at all possible options to help this situation.
Thank you.
Yes, thank you. My name is Ruben, a board member, a board member. I have a question. I've heard Mr. McKenzie saying something about the hours, the requirement. What is the requirement that you have for ACON?
There are different requirements, and as Jason's our Director of Accreditation Services, I'm going to let him give you the specifics as far as the number of hours. We have master degree in acupuncture, one with acupuncture plus Chinese herbal medicine. We also have doctoral level degrees, and we have an advanced doctoral program. So Jason, you want to take that one?
So one important point of clarification, just or point of fact for the board to be aware of, is that California is one of the handful of states that requires comprehensive herbal medicine training as part of entry level into the profession. Most of the states do not. So we have a significant number of programs that are delivered with acupuncture only education, with the opportunity either to not study herbs at all or to add the herbs at a latter portion, either via a certificate or in addition to the program training later. So the bare minimum for a program to get license eligible in most of the other states aside from California is 1,905 block hours of instruction right now over 3 academic years. When you add herbs to that master's level training, so it's Master of Acupuncture with the Chinese herbal medicine, is 2,625. California currently sits in excess of that at 3,000, and I believe there's a proposal to raise that up to 3,300. If you go to the doctoral level training, the Doctor of Acupuncture without herbs is 2,035, so about 120 more than the Master of Acupuncture. And the Doctor of Acupuncture with Chinese herbs is 2,755, still below the current California requirement and well below the proposed topic that's on the floor right now.
Oh,
And many, in looking at state licensure requirements, the hour requirements for states vary from, many states don't even stipulate the number of hours. They stipulate graduation of an ACOM accredited or approved program. And then for states that actually stipulate the hours, it ranges from as little as 500 to 1,000 hours all the way up to the 3,000 hours that California sits at the top with.
You were saying is related to the cost. Schooling cost is the reason why you guys want us to lower our standards too?
No, that's completely up to the state. What we're looking at is, are those hour requirements right now necessary for, because it's a bit of an old practice in higher ed to be prescriptive in those number of hours. If you look at many of the other healthcare professionals now in education, they don't prescribe hours. They prescribe achievement of professional competencies. And higher ed in general is shifting towards trying to make programs more efficient and more affordable, provided you're able to demonstrate that your graduates are reaching those professional competencies for competent practice, safe practice. And so we have a robust set of professional competencies. We just did a thorough revision of those and adopted them in February of 26. Those are based on a set of professional competencies that originated in medical education, and then we brought them into and incorporated additional pieces that we thought were important for acupuncture and herbal medicine education. So that the talk right now is not about decreasing the quality of the program or decreasing the scope of the program. It's that if a program can demonstrate that it can get to the competencies in training a practitioner in fewer hours, should the commission require that they have those excessive hours if they're meeting the professional competencies that demonstrate their graduates are effective and safe providers?
Yeah, thanks, Jason. And just to emphasize, ACOM is not taking a position on the number of hours that California chooses. That's totally up to your board and your practitioners. We are here to provide information however we can that can be of assistance. We do want, I think the important thing right now is, given the focus on higher education federally and with the Department of Education and Title IV federal student aid, and the regulations that they've put in place, the access to federal aid is going to go down. We expect that enrollment will likely go down, and because of that, schools will have to retool, and they may lose some access, and some schools may end up closing. So it's just, I think that's more of a situational issue than. I'll just leave it at that and turn it back to you, Ruben, if that helps you.
Yes, it does. Thank you. I also want to add that it is also the time that we're. It's very, very hard for everybody. A lot of the businesses suffering right now because of what is going on.
Yeah, absolutely. This has ramifications all across the board, not only the students enrolled, but the schools, the faculty, the staff, the administration, and the rest of the profession, the vendors, the people that bring materials to schools, and ultimately the patients are going to lose out because there's going to be less access available. That's a real crime from my perspective.
Yes, I agree. Thank you both very much. Appreciate your time.
Thank you, Mr. Osorio. Any more comments?
I have a quick comment. Mr. McKenzie, I just heard that it will be very difficult for schools to have less access for those upcoming students. That means, with more requirements and higher, the more hours and, all those other requirements. Is there any possibility you can work with those? Because in a common sense, if you reduce your standard of all this education and all that, I don't see this. Maybe school will survive, but I don't see the prosperity of those professions. So, and it'll go less and less. And as you see, here in California, it's getting tougher and tougher to make a practice, not just acupuncturist, but also other healthcare profession. They're coming together to get some other healthcare profession scope. So rather just lowering all hours and standard, maybe you can have a parallel program that can uphold the even higher education standard, which is same as science requirements for as other healthcare professions requirements. Is there any possibility?
Well, as I mentioned briefly before, it's like we're open to looking at all possible solutions. We've opened up our, basically we always do that, but we're really looking to the institutions, to your board, to other states and other practitioners and societies of practitioners to provide any suggestions. And we're very cautious, as you point out, about lowering standards. That's a very challenging circumstance, and there are a lot of negative consequences to that. And you have to, as an agency, we're going to have to look at, does that make sense? Can we offer it different ways? Can we do micro credentialing? So we have not taken a position on anything. We are not at this point. The commission is not considering, does not have a specific thing that we're considering, but we are looking at ways to improve efficiencies, hopefully reduce costs for students and overall. So I'll leave it there.
Thank you.
A point of clarification for members and the public, just because it's come up a couple of times. The board isn't looking to change the curriculum hours. That is a bill that we'll discuss later that is pushing that out there. And so just keep in mind that it's not board driven at this time. And actually the presenters, the sponsors of that bill will be presenting after ACOM as well.
Thank you, Ben. I appreciate that clarification.
Certainly.
So any more comments? I put myself the last because I have several questions. So thank you for all the very clear answers from Dr. McKenzie and Mr. Jason Wright. So my first question is, remember last year you came to the board and reported degree naming unification, and the board has the licensing committee twice at the meeting discussed the degree naming unification. Is really, for board point of view, protect the public is our priority, anytime priority. So we appreciate ACOM's job to unify the degree naming. My question is, has the degree naming unification now in place? As I look at your material online, I saw that I think I'm more confused for like a DAOM, the 1,200 hour education for DAOM, advanced doctoral degree, one name, right? So from DAOM now change it to DAIM. So for entry level professional doctor degree program, that's probably the most messy, different name. Every school seems can take their own name. So I saw somewhere said suggest to use or require to only use DACCHM or DACHM. Is that the current update? Thank you.
Yeah, so the policy was adopted and it's pretty much the current status in 2022. Programs were expected to comply with it by 2024. And at this point, I don't believe we have any schools that are out of compliance. Now, there is some flexibility within that policy because there were a few things. There were issues with state higher ed authority in some places with certain parts of the name. So sometimes schools were not able to adopt the name in its entirety. So there were restrictions that a state higher ed authority imposed. There were also changes that we allowed schools to do based on personal preference. So within that Doctor of Acupuncture and Chinese Herbal Medicine, and remember there's two options for that entry-level doctor. There's a Doctor of Acupuncture only if you're in a state where you don't need herbal medicine to practice. In the state of California, the Doctor of Acupuncture and Chinese Herbal Medicine would be the standard ACOM name. The full name is Doctor of Acupuncture with a Chinese Herbal Medicine specialization. School can drop the term specialization, so they could call it a Doctor of Acupuncture and Chinese Herbal Medicine, but we also had the request from schools to not put the Chinese qualifier in there, and so that we also allowed them to say Doctor of Acupuncture and Herbal Medicine. So those are the three basic options. At a master's level, you could have Master of Acupuncture and all of those things. Chinese Herbal Medicine, or Chinese Herbal Medicine specialization, And at the master's level, you could also insert the designation of it being a Master of Science program versus just a Master of Acupuncture program, because some states actually mandate that that science qualifier be included in the master's degree.
Thanks,
I
Jason.
see.
And the only thing I want to add on to that is that ACOM worked for many years with the council, with practitioner groups, to try and come up with an agreed upon naming degree names for the profession. Ultimately, there was not consensus, and most of it was a 50-50, 52-48, 60-40 kind of split on agreement on anything. And so ultimately, the commission chose to grab the naming protocols that we have now. We also acknowledge that it can be challenging to understand, from the public's perspective. So thank you for the question.
Thank you for your answer. Yes, your answer is very clear, and I understand that this profession is very complex. In one hand, this is a good thing because this acupuncture profession actually covers Chinese herbal medicine, Tuina, like you said, Asian body work, right? Your certificate name, Asian medical body work. That actually is like a Tuina, right? So how do this like Asian medical body work certificate align with the massage certificate? Because I heard in California, school cannot get a massage certificate or program. Can they just use Asian medical body work to get certificate and
So
practice?
the
How align?
governing of the massage therapy licensure varies in jurisdictions within states. So it's sometimes at the county level or even at the city level. We don't have involvement with massage therapy licensure. So we have a certificate in Asian medical bodywork so that programs can teach any variety of Asian medical bodywork that they choose, whether it could be Tuina, it could be Amma, it could be Shiatsu, it could be any one. Those programs could be expanded beyond ACOM's minimum program requirements to include the state requirements to achieve massage therapy licensure. So we have one program so far that has been approved for a launch. They're not yet accredited, but they've been approved by ACOM to open their program. And they have approached the state and been given state approval for that Asian medical bodywork program to make the graduates eligible for a licensed massage therapist credential. But that's not within ACOM's scope to do licensure eligibility with massage therapy. So schools can develop a program that complies with our program requirements. And if they want to go above and beyond that, then they could work with their state or a national massage therapy board to see if their graduates could be eligible to get that alternate licensure. Right now, the program is designed to not necessarily get somebody to licensure, but it might be what you call a feeder program, where you could get people interested in Chinese medicine and they could go through that massage therapy program or the bodywork program, and that might inspire them to go into a deeper program like a master's or a doctoral program. Sometimes it's massage therapists or other providers that recognize the value of Tuina or Asian bodywork that is above and beyond their current massage therapy training, and they want to expand their training. So there's a variety of uses for it outside of just going to straight massage therapy licensure. And sometimes it's an acupuncture provider who didn't have robust training in bodywork in their program that they graduated from, and they want to actually expand that skill set under their current acupuncture license.
Thank you. So understand with the Asian medical bodywork certificate, maybe can apply for National Massage Board certificate? Is
That would be
what,
for each
what you
program
suggest?
to negotiate with their
Oh,
individual state body or national body. The group that has the program that I referenced was working with their state massage therapy board to determine if graduates of their program could be eligible for licensure in that state. And the answer was yes, they could be. And that was the very first one of these programs that has gone through that process to ensure that their graduates could be license eligible as a licensed massage therapist. And their strategy is, maybe that is a feeder into the master's or doctoral program, but it also gives students an opportunity to have some level of employment that's focused on the field of Chinese medicine while they're also studying to get their credentials to become a licensed acupuncturist.
Exactly. Thank you. So I think that open a door for employment, because also for the student practice, before they put the needle, they touch the patient to feel the muscles, feel the energy. Really is a good pathway. So who is doing this job? Would ACOM talk to like a state massage board or any jurisdiction?
That's up to the schools. So the schools would get
School
approval
had to
from
go.
us
Okay.
to meet our minimum curricular requirements. Then they would look at what would be the credentialing requirements for the state agency that they're looking at, or if they're trying to get in with a national level. And then they would have to modify their curriculum above our bare minimum, because our bare minimum is not equivalent to a standard often license eligible massage therapy program. They would have to add some curriculum to it, most likely, depending on state regulations.
So how many hours of training?
The other piece to recognize is that ours has a higher entry level for admission than your standard massage therapy program, because a standard massage therapy program you could enter out of high school at age 18 with no other college training typically. And within our scope of recognition from the Department of Education, we can only do graduate level programs right now. So our certificate programs require at least 2 years of undergraduate education in order to be eligible for admission. So it does have a higher bar in terms of getting into the program than a standard massage therapy vocational program might be outside of Asian medical bodywork.
So the massage Asian medical bodywork, how many hours of training?
Let me see. I have that here. 550 minimum.
So I really see the possibility the patient, the student start work, learn this, but any requirement? So the requirement is come into the program and get this training. Anyway, so
and we do have programs within the state of California that have received ACOM approval that are currently working with. I'm blanking on the name of the massage therapy board in the state, but they are working with that, I think CAMTC maybe.
Yep. That's correct.
Yeah. Okay. So there are schools in process with that. I haven't heard from that school in a while, so I don't know how successful they've been, but they're working through that that approval process with CAMTC with a program based on our core curricular requirements, but then going and adding more to it to make sure to meet CAMTC standards that might be a little bit higher in terms of number of hours.
Appreciate the answer. Second question, how many schools are accredited as master's degree program, and how many schools has entry-level professional doctor degree with PD program, and how many school has advanced doctoral degree program?
So to the moderator, could you slide back in our slide deck, maybe 4 slides or so?
Yeah, it's to slide 4 is the breakdown.
Okay.
So there's your, it's 113 total programs. You got the Master of Acupuncture. There's 25 or 26 of those right now. My count was 26 when I did it yesterday, but that says 25. But remember, those acupuncture only would not be license eligible in California. So then you can see the numbers there. I don't need to read them to you.
Yeah, but I did I couldn't count back the act. It's entry level. Oh, you have DAC and DAC CHM, so 19
and
DAC CHM.
remember, those are there are also some programs that have been approved that are in operation but have to go through the accreditation process. So there are some additional, like for instance, that certificate in Asian medical bodywork, we have one that's accredited, but we have 3 others that have been approved to begin enrolling students, but have not yet achieved accreditation. So some of those numbers will go up as programs get through our process.
So actually, there's 38 was the herbal medicine.
In the master's.
At the master's level, and then 19 at the doctoral level.
Okay. Thank you, because I couldn't do the math when I listened to you talking.
Before it's, when I see this, I just came up with a question. Do you guys have any communication with the athletic training board or anyone in other states who's doing dry needling?
As far as
really the
go ahead, Jason.
Mark. Well, I was going to say that's not really the scope of an accreditor. That's more on the side of both the profession of the practitioners, like a professional association, and or the schools to negotiate that. We have looked at, would it be appropriate for our acupuncture programs to be providing training for other healthcare providers, for MDs or DOs or DDSs or PTs that would like to incorporate acupuncture? Because honestly, you may not be able to prevent other practitioners from doing acupuncture, but the folks that teach the acupuncture should be the experts in acupuncture, which are acupuncturists, not physical therapists or chiropractors or even medical doctors. So that's one of the things the commission has been considering, honestly, for decades. And it's something that we may see the commission come out with, but at the same time, you run into challenges with your professional associations of acupuncturists that don't really want other providers to have training in acupuncture because they feel that it impinges on our patient base, our scope of practice. So it's a complicated scenario, but to your question, integrating with other professions is not really the role of us as the accreditor. It would be more through the Council of Colleges, the schools, or professional associations. And then if they had a proposal for how an accredited program could interact with something that's happening at another profession level, they could propose it to us for consideration of whether we could adopt standards for it.
Thank you.
Okay, thank you. So it's harder to make a comments about that. Overall, if other professions want to do acupuncture, if they have same or similar qualification as acupuncturist, probably it's a good thing, right? But so who to give them accreditation? Can ACOM give other profession want to do acupuncture accreditation in some way? Or
Well,
if
so
not out of control, that's
sure.
yeah.
In any case, they need to meet our standards in order to be accredited. So they would need to be offering the same programs that acupuncture schools are.
So in California, MD, DO, dentist, and podiatrist, they can do acupuncture. So we don't have, California Acupuncture Board does not have any right to control that quality. And I don't know if ACOM work with them, give them like
Well,
a,
so right now, if one of those providers wanted to go through a master's or entry-level doctoral program, they could, and they would receive, I'm assuming, a significant number of transfer credit for the basic science and clinical sciences courses that they already have training in their native profession. But that would not, it still would amount to a fairly large program, which many health providers, especially at the MD, DO, DDS level, are not interested in a 3 or 4 year, 2,000 hour program. So that's what I was referencing in answering Dr. Kim's question. There is the potential that ACOM could adopt standards for an abbreviated program for healthcare providers that would allow our schools to teach those providers of other health professions how to be safe and competent acupuncturists, or not acupuncturists, how to provide acupuncture as a modality safely. That has not currently in place. There historically has been a great deal of resistance, or at least concern from the profession about training other providers to what they consider steal our aspects of our scope of practice. But it is something that is a topic of interest right now, as I referenced, because we're the best trainers for teaching the skill. And it also provides potentially another income stream for schools that might be valuable as things like federal financial aid income streams dry up.
so it's possible ACOM work with other healthcare
That's possible.
profession.
So we've talked about like what would it look like to do an MD, DO, dentistry, doctor of chiropractic focused program that would look a lot like, in terms of size, the one that UCLA has historically done. So there is that potential. But right now, that's just a topic of consideration. There are no draft proposals available yet, and we would be putting it up for public comment to solicit feedback from the field and all of our stakeholders if we were looking to potentially adopt something like that.
So UCLA done, you said historically done 300 hours.
300 hours, yeah, that's
Yeah,
been the standard
but-
program for
Mhm.
MDs.
So UCLA also has the integrative program for residency. That's 2 years.
Mhm.
Anyway, okay, thank you so much for your updating. And I have last question about prerequisites. Number one, master degree, enter the school with 2-year college education. And for PD program, require 3 years. So what's the difference of 2-year and the 3-year? And why not 4-year? And why 2-year or why 3? I mean, I understand why 3 years.
So in looking back over the evolution of the profession, that 2-year requirement was input in 1983 when the profession was originally kind of coming up, and the accreditation commission under the NASCOM at the time was the acronym. That was the standard that was implemented back then, and that has not been changed since then. When the entry-level doctorate was proposed in the early 2000s and then finally adopted around 2013 with its final standards, that had a 90 undergraduate requirement because you couldn't justify getting all the way to an entry-level professional doctoral degree with only 2 years of undergrad. And we already are a very unusual higher ed program structure, because it's not normal to get to a master's degree with only 2 years of undergraduate education either. That being said, your normal master's degree is typically in the 30 to 30, 40 type of credit range, and our current master's programs are in the 100 to 170 credit range, which is significantly larger than any other master's program out there in the universe, I think. There has been interest at the commission level to raise that entry level admissions requirement to 90 undergraduate for all programs, but that has historically been there's been opposition for that from the body of the Council of Colleges in particular, and sometimes from the profession as a whole, stating that that makes it makes the program more expensive and harder for students to achieve. I, there's still interest in raising entry level to be consistent across all of them, and also to be more consistent with the practice of higher ed in the United States, to at least raise the entry level to 90 undergraduate. I doubt you would see it going to a full bachelor's degree, because right now there is actually the incentive to decrease the length of bachelor's degrees and make bachelor's more affordable. And you see other professional programs, like, for instance, even Doctor of Chiropractic, where you only need 90 to get in, you don't need a full bachelor's degree. So we'd probably stay in line if we were raising it to align with other professions, but also not to add a considerable amount of extra income that's not directly related to the professional training. That still runs into, we still look at how much does it cost if a student comes out of high school and wants to become an acupuncturist. You do want to try and make sure the program doesn't have too much extraneous information that might not be relevant to the professional training, that would cause them to leave with sometimes tens, if not hundreds of thousands of extra dollars in tuition investment that weren't necessary for their training to be a safe and competent practitioner.
Okay, thank you for the answer. So is possible like get a student from high school come out to the acupuncture school and has a pre-acupuncture school college education and a dedicated like a basic science. So probably that is a one way to lower the cost of acupuncture school cost, because a community college only costs maybe $40-something a unit, but acupuncture school maybe $300 a unit.
Sure. So yeah,
maybe
and
we
right now,
start early to go to high school. The school go to high school. Educate school has. I was invited several times. I told them, hey, to be acupuncturist. School has a career consultation for senior students. And how about is possible for
so yeah, right now
accreditation
under
to
ACOM's accreditation standards, schools can accept transfer credit from those undergraduate credits towards program completion requirements. So if somebody entered with their eyes on an acupuncture degree for either a master's or entry-level doctoral program, they could be doing a pre-med type of bachelor's first couple of years to do things like anatomy, physiology, biology, chemistry, and get some of their general education requirements. And a number of those credits could be transferable into the graduate program that would allow them to basically start with an advanced standing type of position. So schools, that's already available within the standards as they're currently written. Not many schools have taken advantage of that, but one of the things that I think schools are looking at, as Thomas said in the council's presentation earlier today, they're looking at ways that maybe there might be more efficient ways to deliver education, and one of those might be to outsource some of those basic science requirements into the admissions requirements, so that the student would have them and the school wouldn't have to teach it, and the student would come in with those credits already completed.
Yes, I think that like those maths, if the the prerequisites or co-requisites, the part of basic science can teach in the prior they come to acupuncture school, so that will save them money, and that 1 year or 300 hour, 450 hour, that education of basic science also can apply to acupuncture schools credit, right? So that's
Yes, they can
the
now,
way.
yes. And we have some schools that are accredited now that have used that strategy for years. Many of them don't. It's not a huge savings, because in the biomedicine category as our standards are currently written in the master's and doctoral programs with herbs, it would be a total of 510 hours. And you wouldn't be able to use all of those from undergrad because some of those are going to be clinically relevant, biomedical focused things that you need as you develop some of your understanding of the Oriental medicine theory and basic foundational structure of being an acupuncturist. You'll still need to have some of your clinical sciences tied to that. So those, not all of those 510 could be done before you're studying some aspect of the theory and the practice of Asian medicine. But certainly you could get some of them out of the way, like things like anatomy, physiology, biology, chemistry, physics. Those could all be completed, and if they're required in your program, you could accept those as transfer credit.
So, other words, the third year or the 30 units for the requirement of, from 60 to 90, right? If the student only has 60 units, they need to make up another 30 units of the college units. ACOM does not require them to take basic science, no requirement. So
No,
they can
right
take
now
whatever.
those 60 and 90 credits for masters, and then for the entry-level doctorate, we don't have prescription about what those need to include, except in the doctoral program, the standards do specify chemistry, biology, and psychology. But it also allows those chemistry, biology, and psychology to be taught within the graduate level program if the school wants to, because historically, in particular in the state of California, schools had to include some of those because they were part of the core curricular requirements mandated by the curricular review of the state board. And so schools, when we published those standards years ago, requested and were approved to continue to offer those courses because they felt that it might otherwise jeopardize their curricular approval at the state level.
So what is the English requirement now? TOEFL, what's the score? The same as before, 60?
Same as before. So there's a set of
61?
scores. 61 is the TOEFL there, and then there's scores for other standardized assessments. That's only for international students, so students that are on an F1 study visa. The schools are required to have an admissions policy that addresses English language proficiency, but those benchmarks of the standardized tests are only applicable for international students. If the school wants to set a different bar and can justify why that bar would be lower for somebody else, they could do that, but they would have the challenge. It would be their burden to demonstrate, to validate why they've set a different standard for different students.
And the international students go to community college, get an English class, and to replace the TOEFL 61 score?
Well, they can study for 2 years of if they've completed 2 years of education in English anywhere, whether it's high school or college level, they can use that instead of the standardized test. The standardized test is for people who cannot demonstrate that they've had ample training in or educational delivery in English. Then
So
they have to sit for the standardized test.
2-year high school, college, or college has to be in the U.S.
No, not necessarily. They have to demonstrate that it was delivered in English. There's a long list of countries that are possible for that. And that's under criterion 5.02 if you want to look at the comprehensive standards on our website.
Okay, if not in the U.S., how to check their credibility, or some take English from Canada, no problem, but not English speaking country, then how to check their.
Right now, if the country is on the list, which includes everything alphabetically from American Samoa to Zimbabwe, it would be acceptable because they can demonstrate that the language of delivery in that country was delivered in English. And then those transcripts, whether they're high school or college level, would still need to be run through an international credential evaluation service to validate whether they're equivalent to training in the United States.
I see. Very, Thank you for all the answer. And just a little, when you talk about the hour of, when Mr. Osorio asked the education hours is very important. So I heard the master's degree is 26.25 or 26.50 or 25. Anyway,
Let me give you the exact numbers. 2625 right now.
25. So for PD is 27,
2755.
775, 27.55,
Yep,
right?
correct.
Okay, so in between, it's about how many hours difference?
130.
130-hour difference.
Yep,
So
yep.
what income requirement for the school to implement this 130 hour? I read from ACOM the PD program as the completion or bridge check. The requirement is 300 hour, at least 130 hour for clinical training, and 170 hour could be didactic courses. So what's the significance of this 300-hour design? Like, what's the expectation for the school to teach students? Thank you very much.
The expectation for a doctoral completion track is that they can demonstrate that the student has met all of the professional competencies that are required within that school's entry-level doctoral program. So they need to do a crosswalk comparison of what did the student learn in their master's level training, and then what is above and beyond that master's level training, and then make sure those competencies are assessed before they can confer the completion track option for a master's level graduate.
So for what I read from your documents, my understanding is like a 300-hour emphasize integrative medicine practicing model, right? And,
right, those are the competency differences were in primarily in systems-based medicine and collaborative care.
Yeah, so the competency is higher than master's degree, and there's a multidisciplinary environment practice, and which is very
It's
important.
what separates the entry-level doctoral program from the master's level program in terms of competencies was yes, is the instruction for graduates to be more competent in practicing in systems-based facilities like a hospital or a Veterans Administration or something like that, and to be able to collaborate with other healthcare providers. Now, many of our master's programs do exceed ACOM's minimum requirements and have already incorporated a lot of those skills within their master's program. That's why you see some doctoral programs and master's programs looking very, very similar, if not identical. That's because the school had designed a master's program that exceeded ACOM's minimum requirements and was already inclusive of those types of competencies around collaborative care and systems-based practice.
Yeah, so this 300-hour looks very important for the practitioner, just the new graduates, new licensees to be able to work in the hospital or medical center and work together with other healthcare professionals to be part of the mainstream. Right now, I heard the professor, we are singled out from medical, from this, that. So if you want to be on the table with a mainstream health care provider practicing in the system-based, that's the system means the whole healthcare system, that based practice. So make the acupuncture be more visible, more credible, can get recognition from other healthcare providers, especially for MD, DO. Right now, the patient get surgery, post-surgery care, their prescription, usually physical therapy, not acupuncture. But acupuncture really can help reduce the pain, the swelling, the inflammation, and could be very helpful, but no connection with the orthopedic doctors And if this 300 hour will help the student, help a licensee to better prepare to practice in the mainstream, in the system, part of the system, and will help a patient more. So a lot of patients, after they doing this, that, a lot of treatment, then finally, couple months later, come to acupuncture as a last result. But acupuncture should be up in the front after the surgery, be part of, together with other healthcare professional, like a PT, chiropractor. So that's the answer from you for very clear for the 300-hour doctor PD program as entry level. So entry level doctor degree is like a basic requirement. That's the program set for the significance. So thank you for your answer. Thank you, sir.
You're welcome.
That concluded my questions. Sorry for long questions. Maybe you need a lunch.
We'll be done with this shortly, but just a quick follow-up questions for Director Wright. Is there a set time that the TOEFL needs to have, that an applicant or a student at any one master's or doctoral level program needs to meet the minimum score? So at entry or 2 years in or completion? Is there?
It's upon admission to the program.
Upon admission to the program, okay.
Yeah, so that was a shift that used to be the piece that you're referencing of getting in. There used to be a piece within the accreditation criteria that talked about, in particular for programs delivered in Korean or Mandarin Chinese, there was a window where the student didn't have to demonstrate that English language proficiency, which at the time was also at a lower level. It was in the 45 range, but they didn't have to demonstrate that until entering clinic. And we encountered in sort of the early time of when both myself and our Director of Regulatory Affairs joined the commission staff, so about 10 years ago, we encountered a number of complaints where students had gotten 2 years into a program and then were denied access to continue the program into clinic because they had not achieved English language proficiency that met the minimum bar. And that's a big operational problem for a school and a big liability to have people, you know, paying years worth of tuition for a program that they're technically not yet fully qualified to be admitted to. And so the commission made that change to ensure the student safety and protection, that they are at the very least qualified to enter the program when they enter the program.
Thank you. So then it sounds like for current programs that offer the education in a language other than English, all those students would be required to prove that TOEFL score prior to?
The bar is the same. So the bar is the same regardless of language of delivery. The piece about the TOEFL mandatory requirement is that that's for international students only, F1 students, so students that are coming in who are not US citizens. But the program also has to be able to demonstrate that it includes explicit English language proficiency requirements in its admission standards. So if they set a standard that's far lower for domestic students than it is for their international students, they would have to demonstrate and validate for the commission why and how that's appropriate.
Thank you. This is clear. And then has ACOM worked with CCOM to identify whether or not the clean needle technique is provided at the TOEFL requirement level for all students?
That's a good question, Ben. And no, we have not had that conversation with the council around the requirements for taking the CNT exam.
Only because it might address the need for a different language clean needle technique, which I understand your organization is not responsible for, but it could meet those qualifications prior to licensure.
Yeah, and that would be a question for the council. And as Thomas alluded to, you know, the council did offer those when I was at the council did offer those programs in other languages and even offered them in other countries, because I know we did pilot them at that time. I'm certain we were in Korea. I think we were in a few places in China as well. But again, the cost outlay. So I'm not speaking for the council now. I'm speaking from ancient history. When I was on executive board of the council, it was an expensive investment with very little return for both the delivery in alternate languages and certainly the delivery in other countries.
Thank you, Director Wright.
Thank you so much for your answer and so professional. I'm very impressed with all your very clear answers. When I more read the document of ACOM's material, I'm more impressed. It really is very, very professional, efficient accreditation body. And so I just, this is not really a question, just thought from all the numbers. Number matters, right? We have to do the math. From master's degree to PD program, there's only 130-hour difference. Is it possible? Just merge them. So reduce the work for the board, work for your 130-hour difference. Like you mentioned, the hour doesn't matter. How about just make this, and we have the, under the pressure of the profession, be treated as non-professional, as nurse, as OT, because I mean, look at the chiropractor. Chiropractor is treated as professional. So what's the difference in between acupuncturist chiropractor? Of course, they have doctor degree as unified professional name card, and acupuncture. I saw ACOM's document. We define ourselves as a graduate program, and we're master degree graduate. It's possible to make how to make our make this profession as a professional standard professional program, and get the full 100% of the loan, not be cut in half. So is it possible
the biggest
to
challenge
just
is
make a
not the biggest challenge is not going to be the cut in half, but the biggest challenge is going to be cut to zero, because it's
Wow.
highly likely
Okay.
highly likely that in 2 years, by July of 2028, there will be no federal financial aid eligibility for master's or doctoral level programs. Now, there is still the opportunity, as Mark alluded to, for changes to potentially happen, but you also should predict for the worst case scenario on a professional level. And the worst case scenario, which right now appears more than possible, it appears likely that the schools will not have any financial aid 2 years from roughly right now.
Okay, so what's the solution? Everybody here in the room, professional. Maybe today I heard the efficiency. I think that's the most important.
So the things that we're looking at the commission level, and we'll be soliciting public comment very soon on this, to get some input from states and from practitioner base. There are potentially taking off some of the mandatory requirements for quantity of hours and leaning into programs just meeting the professional competencies that their graduates have to achieve, and ensuring that they're assessing those competencies appropriately, which would allow schools to potentially lower the number of credits, which might make the program more affordable if loans are not available. The other option that's on the table for consideration, but it's nowhere near being proposed as a possibility, but I'll just throw it out there, is that you could potentially drop the entry level all the way to a bachelor's degree, and fit the Master of Acupuncture, not with herbs, but with acupuncture only, into bachelor's level training, which would change the earnings metrics threshold that a program would have to meet under the accountability, the gainful employment metrics that we talked about early in the presentation.
Along with what Jason is sharing, there's things that ACOM can do as an agency, but there are things that the profession can do that exceed what we're able to do as well. And schools have some options. I think part of it is identifying what the problem is and letting legislators, federal legislators, the Congress, know what the potential impact of this is going to be. You know, because it's going to be significant. So we could spend hours talking about this, but I know you're probably short on time. So I'll just leave
Question
it at
for
that.
Ben. For Ben, I see that on your agenda we're still in point 5 right now of professional association updates. You're heading into 6, I assume, later today.
Correct.
Is that someplace where you think it would be valuable to have ACOM's input on those topics? Because I know Mark alluded to them in a slide deck, but we're not even to that yet.
Right.
I just want to plan my day appropriately because I'm also in the Eastern time zone and it's getting late.
Indeed. ACOM's knowledge would be helpful for item 6. We'll see here if we're taking a lunch break or a short break after this, after your presentation, and then that will give us a better estimate as to when that item will be taken.
Okay, thank you.
Okay. Okay. We need to take a break, right? Moderator?
ACOM, thank you so much for Directors Wright and Mackenzie. I appreciate your input and knowledge here. This has been very helpful.
Thank
For
you.
sure.
Ben, if you can let us know or let Jason know, I will not be able to join you. I've got 3 other calls yet this afternoon that are pre-scheduled. So I think Jason's completely qualified to address the issues that were under item 6.
Okay. Thank you, Director Mackenzie.
Seems that we have to invite you to come more often to the board meeting because once a year, really a lot of questions. Okay, let's take a break for how many minutes? Ask legal.
This is Gregory Leon, public members. On the floor, there's somebody wants to ask a question. Can that person ask that question?
In the end of the all the association update.
Okay.
Just speaking, I'm sorry, President Chen. If there are questions that come up when I'm not available or Jason's not available, Ben, if you could get those to us in email, we'd be happy to respond in writing to you, just to follow up in case somebody has a burning question that doesn't get addressed today.
Thank you, Director.
Appreciate it. Your email address is on the website, right?
Ben, I think Ben has it. He has my cell phone. He has Jason's cell phone, so we'll get the information.
Thank you.
Thank you. Appreciate. See you next time.
Thank you all.
So we take a break. 15 minutes.
Or do we need to do lunch? It's now 12:22. We should probably do at least a half-hour lunch, 45 minutes. Presenters from CAC and CSOMA, if you'll bear with us. We must address staffing.
For lunch break for everybody.
1 hour. So it's 12:23, back at 12 or 1:25. 1:30. 1:30, everybody.
1:30.
Thank you. The board has returned from break. I'll go ahead and take roll call. Dr. Yangping Chen. Francisco Kim.
Present.
Dr. Shudong Li.
Here.
Gregory Leon.
Here.
Ruben Osorio. We have 5 members present and quorum. We may proceed.
Thank you, Badia. So
Welcome.
we're going to item 5, number C. So the board meeting, you never know the timing, like exact time. So I hope all the people waiting online have come next to presented to the CAC, California Acupuncture Coalition, and the CISOMA. And I saw CISOMA Dr. Chen is here, and I hope CAC's representative is there too. Anyway, so one by one, we have 2 association update. Appreciate your effort to update the board.
We have the coalition ready to go.
Okay, coalition was here.
Hi, I'm online here. Brian McCarthy here with the California Acupuncture Coalition. Can everyone hear me all right?
Yes.
Okay, glad to hear that. Well, good afternoon, everyone. Thank you so much for inviting the California Acupuncture Coalition to speak at the Acupuncture Board meeting. We always appreciate being in front of you and getting to share the work that we're doing on a daily basis with you all. So thank you again for having us. My name is Ryan McCarthy. I work on behalf of the California Acupuncture Coalition. With me here today, also online, I have Dr. Lin Yang and Dr. Anyork Lee. They can help answer any technical questions that may arise during the Q&A portion of this agenda item. Next slide, please. Just to give a bit of background on the California Acupuncture Coalition and who we are. We're a platform for state acupuncture associations to work together. This group was born several years ago. As I'm sure many of you know, in the past couple of years, there's been budget fights during the May revision when the governor has suggested that maybe they take the Medi-Cal or the acupuncture benefit out of Medi-Cal. And we wanted to bring together all of the different acupuncture organizations within the state under one group to be able to work together and have a unified voice to combat those attempts to remove state funding from acupuncture. So that's sort of how we started. We have a lot of groups, a lot of representation. You know, we pride ourselves on representing acupuncturists across the state of California. And our group is comprised of acupuncture associations as well as schools and different medical facilities as well. Next slide, please. We are primarily an advocacy group. I am a registered lobbyist. I work on behalf of the CAC. Most of them are not registered lobbyists, at least to my knowledge. But this year we are working on 3 pieces of legislation with different respective authors' offices, but all with the goal of advancing the acupuncture profession in the state of California. The 3 bills that we are sponsoring are SB 944 by Senator Scott Wiener, Assembly Bill 1949 by Assemblymember Alex Lee, and Assembly Bill 2668, sorry, by Assemblymember Fong. I'll touch on each of these bills in the next couple slides. And then there's one bill that we are opposed to. It was introduced after the agenda had already been publicly posted for the meeting, so I don't think we were able to get it on there. But it's AB 2497 by Assemblymember Natasha Johnson. It's a bill that relates to it would expand the ability of the physical therapist to practice acupuncture, in their words, dry needling, but a bill that we are in strong opposition to. And I'll touch again more on that later and how we can work together to build that coalition to make sure that we are united against this expansion of scope and the physical therapist's desire to practice acupuncture with no training whatsoever. Next slide, please. So the first bill that we're working on is Senate Bill 944 by Senator Scott Wiener. The way that acupuncture is written in Medi-Cal in current state law, there is a line of text that says acupuncture if matching federal funds are provided. It doesn't say this for any other Medi-Cal benefit. So chiropractic, chiropractic, I don't know if that's the right term, sorry. Physical therapy, there's other benefits in Medi-Cal that do not have this federal funding language tied to it. We're not entirely sure how it got there or why it got there, but the goal of this is to just make it to enshrine Medi-Cal in California state law as a benefit that will be paid regardless of these matching federal funds, and to provide stability for Medi-Cal funding for the profession. We actually had some great momentum on this bill yesterday. This bill was heard in the Senate Health Committee. We had the president of the CAC, Dr. Danny Zhang, there to testify, and another acupuncturist from the Northeast Medical Services. They're an acupuncture medical organization up in San Francisco. They were gracious enough to come down and speak in support of the bill. So that bill passed out of the Senate Health Committee. We've received no opposition for that bill so far, an overwhelming amount of support from acupuncturists and organizations across the state in support of that bill, which is great for us. And we're very excited to see that there is a lot of positive momentum behind the acupuncture movement at the moment. Several of the Senate Health Committee members spoke up in support of the bill and talked about their experiences with acupuncture and how acupuncture has been an effective method of treatment for them for various different things. So it's great to see that we have some allies in the state legislature who are willing to work with us to advance these acupuncture bills. So I think, can we skip a couple slides here? I think I kind of talked through most of that. Let's go to the AB 1949 slide. There we go. All right. There's one, you know what, this is fine. So Assembly Bill 1949 is authored by Assemblymember Alex Lee. He has been a huge champion for the acupuncture community. We have a great relationship with him. I know several of the CAC members live in his district, actually, so that's always cool to be able to have, you know, members of the group also be able to say, like, I live and practice acupuncture in your district. That goes a long way in building out those relationships with members of the legislature who can be helpful to us in the future. AB 1949 would remove the twice per month service cap on acupuncture services. And the goal is to improve the effectiveness and continuity of acupuncture treatment. It would still have the 24 visits per year, but it would just give individual acupuncturists more flexibility on how and when they want to treat their patients. So, you know, if you have a patient who's just recovering from like a big surgery, maybe you want to treat them every week instead of every other week. And the goal of this bill is just to give you more flexibility in order to do that. So that's where we're coming from with that one. We want to make sure that there's you as licensed acupuncturists who are primary healthcare providers who know your patients better than most others, that you're able to give them the most appropriate and timely care that is needed. Can we skip down to the next slide there? Yeah, so there's been some research that shows that the two sessions per month restriction kind of negatively can impact the goal of what we're doing with certain kinds of acupuncture treatment, and by allowing acupuncturists to practice within their own timeframes and their patients' timeframes, we're hoping to expand better access to care and, you know, continue to keep our patients, you know, involved with acupuncture, as it's a very cost-effective and beneficial method of treatment, especially when recovering from big things like surgery and stuff. You know, as we all know, it can be very effective in keeping people off opioids or painkillers and stuff like that. So good bill. Again, we've received a lot of support for this one from across the state. There are there's no opposition that we've received on this bill so far, and we will continue to advocate for this one. We don't have a hearing set for this bill yet. Obviously, I will let everyone know, and I'm sure you will be aware when that hearing is set. But we don't have a timeline for when exactly this one will be heard in committee. But just wanted to keep you updated on that. All right, next slide, please. All right, this is Assembly Bill 2668 by Assemblymember Fong. This bill would raise the educational standards for acupuncturists from a master's degree to a doctoral degree. The goal of this bill is to raise the hours required to become a licensed acupuncturist in the state of California. It would raise the minimum to 3,300 hours, and then it would also change so that there's a minimum of 2,220 hours are didactic and laboratory training, and at least 1,080 are supervised clinical instruction. Next slide, please. Bill would also establish the Doctor of Acupuncture and Herbal Medicine licensure title. Does not prohibit the use of that title for people with a doctoral degree, and it would take effect on January 1st, 2032. So obviously, this bill would make some significant changes to the licensure scheme that is currently in place in California. And we want to give people time to prepare for that. Obviously, if this was a bill that took effect in 2027, that would be much harder for a lot of the schools to comply with. But we're hoping that by giving 5 years on this one, that everyone can sort of come to a place where we can all work together to ensure that the professional standards are being upheld by increasing these hours. Next slide, please. There are a lot of acupuncture programs in California that already exceed 3,300 hours of training through expanded master's degrees or doctoral programs. We've also seen that a lot of acupuncture students opt for doctoral programs, as is current approved programs. There are doctoral programs that are closer to 3,400 hours, Doctor of Acupuncture and Herbal Medicine programs that are closer to 3,500 hours. So there are courses out there and degrees that are already being offered that are significantly higher than 3,300 hours. So this isn't a new thing. We're not mandating that schools completely change their programming. In a lot of cases, this programming is already being offered. Next slide, please. So the CIC believes that the profession is ready for a high entry-level education requirement. As I mentioned, a lot of schools already do offer that professional doctoral degree program, 13 out of 15. And the goal of this bill is to increase the education for licensed acupuncturists, largely to help with future employment. The idea is a lot of acupuncturists are obviously self-employed, and we hope that by increasing the educational standards, there will be more avenues for work in established hospitals and in established medical systems. There's a shift, from the fragmented healthcare delivery model to a whole health delivery model, and our goal is that by increasing the education, students who are coming out of school will have easier paths to employment than creating their own practice and being self-employed. Next slide, please. Let's do one more slide, please. And then additionally, in the US, most acupuncturists are ineligible to serve as the principal investigators on federal grants. Obviously, I understand federal grants are in a different space now than they were a few years ago. But that being said, it is not to say that kind of funding will not come back and be available in the future. So our goal is by increasing the hours we will be able to have acupuncturists who are able to serve as investigators on these grants. These grants are oftentimes for a lot of money, and when there are opportunities for this kind of funding and studies to be done, we want to make sure that acupuncturists are able to get a piece of that, and able to ensure that the profession is growing through valuable research that's being conducted by acupuncturists about their profession. Next slide, please. So the NCCIH funds hundreds of grants in pain management, and this is an area where we feel that acupuncturists are significantly underrepresented. By increasing the hours of education required, we believe that it will increase our likelihood of eligibility to serve as the principal investigators on these grants. Obviously, acupuncture, a lot of what it is pain management, and the fact that our profession is dramatically underrepresented in these studies and grants is not reflective of the whole healthcare model, that includes acupuncture and should include acupuncture. So let's go 2 more slides, please. There, perfect, thank you. So a doctoral entry-level requirement for licensure would raise professional recognition of licensed acupuncturists. It would improve integration with healthcare systems, qualify acupuncturists for research funding and positions, and provide more research findings for the expanded role of acupuncture service in healthcare. And I think that's really what this bill is trying to do, is it's trying to expand the role of acupuncture service in healthcare by further legitimizing the profession through increased education hours. Next slide, please. So there would be a transition to a doctoral level entry education if this bill were to be passed, and it would maintain licensure continuity. So if you're already licensed, you don't have to go back to school or anything, but it would just modernize the licensure standards for the future. And as I mentioned earlier, it would take place in 2032. So there would be a significant amount of time that the community would have to get up to speed on the increased number of hours required and the doctorate that is required as well. One more slide, please. And the impacts of this bill would be the increased integration of acupuncture into healthcare systems, and improve access to hospitals, academic centers, interdisciplinary care, by raising the hours and the supervised hours, where the hope is that we can have students who are finishing up their training do their last 100 or so hours like in a hospital and get that experience working in a hospital setting with doctors, learning how to communicate in that kind of environment, and just expanding their horizons by being able to be exposed to all the different kinds of medicine that's practiced in the hospital. And by that same token, also having all of the other medical practitioners in the hospital see the benefits of acupuncture as it's being practiced in these established medical facilities. And then, the last thing is we also want to improve the employment rate set by the gainful employment rate set by the education department. And we think that will happen if this bill is passed, because the increased hours will lead to hiring through these established medical facilities and hopefully help people transition to roles in acupuncture within the existing healthcare framework, as opposed to being self-employed. I understand that is a much more difficult practice to do, having to run your own business as opposed to being able to work in the existing healthcare model. So next slide, please. And this will help acupuncturists gain access to federal funding opportunities for grants and research studies to help improve the efficacy of acupuncture and show the federal healthcare systems and the Department of Health how much of a benefit acupuncture can be to patients as it relates to pain management, helping people get off opioids and things like that. So on to the next slide, we'll be transitioning away from this bill. I do want to flag this bill, AB 2668. We have received some opposition from this one. Full transparency. The bill has not been set for a hearing yet. We are still working on getting a hearing date set. And once we have that, we will continue to work with all of the engaged stakeholders to hopefully get that bill to a place where everyone can agree and we can all be unified in our support. Which leads me into the next bill, AB 2497, which is introduced by the California Physical Therapy Association. This bill would allow the physical therapist to practice dry needling without any training. As we know, dry needling is acupuncture by a different name. And this bill is a huge increase of their scope, not just in terms of acupuncture. It does a lot of other things as well, like ultrasound imaging, stuff like that. It significantly increases what the physical therapists are allowed to do. But it is absolutely vital that we, as licensed acupuncturists in California, maintain a very strong coalition in opposition to this bill. This would allow physical therapists to practice acupuncture with zero additional training. And it's just completely wrong. It does not protect patient care whatsoever. It exposes patients to unnecessary risk by unlicensed individuals practicing needle medicine, which they are not adequately trained for. So next slide, please. So just to give a bit of a timeline on where we're at with this bill, we alerted all of the respective organizations on last Friday, on March 20th. The bill was amended on March 19th, but the amendments didn't go into print until Friday. So we caught it the same day that the amendments were printed. We flagged it to all of our contacts within the acupuncture world, the associations that make up CAC, the schools, and the friendly legislators, obviously, as well. They are going to be very, very important in helping get this bill shut down. One thing that I would flag is it is being authored by a Republican author. Not to get too much into the party politics of Sacramento, but there is a significant Democratic majority in Sacramento, so it is important that we, maintain our good relationships with the Democrat members who make up the API caucus and whose districts, experience a lot of acupuncture treatment. So we've been doing as much work as we possibly can to maintain good relationships with them, so that we can activate them to come out in strong opposition to this bill as well. On Monday, we were able to submit a bunch of opposition letters to the author's office and to the Business and Professions Committee against this bill. I do not have the list in front of me, but I think we have submitted over 15 at this point. We've contacted other medical professions, including, the gynecologists, the California Medical Association, who are all going to be coming out and opposing this bill as well. As I mentioned earlier, the bill expands the ability of the physical therapist to do a lot of things. And it goes outside of acupuncture. It goes into a bunch of different fields, and all of those fields are not happy about it, which is why we are working to build that big coalition of other medical professionals to come out in opposition to this. We also released a petition online to protect California from unsafe dry needling. The link is on the slide if anyone is interested in signing that and having their voice be heard. Next slide, please. So yeah, the goal of this is we want to work together to safeguard access to acupuncture service and to make sure that only the licensed professionals are actually able to practice this important kind of medicine. I think it's a testament to how effective acupuncture is that the physical therapists want to practice it. But that being said, I think they are going about it in the wrong way, as they are not proposing to have any sort of education regarding acupuncture. They would instead just like to start poking people with needles. Next slide, please. Thank you for your support. We appreciate, again, the opportunity to present to the Acupuncture Board on the legislation that we have been working on over the past several months. And if you have any questions, we would be happy to answer those during the Q&A portion. Thank you.
Thank you, Mr. Ryan, Mr. Makasi. Thank you for all the report, all the bills. I think about you talk about 4 bills regarding acupuncture practice and insurance coverage and the scope of practice from other health profession may want to do acupuncture, dry needling. Anyway, so any questions from the board member?
Yeah, this is Francis Kim. I have a question. How many licenses supporting this? How much percentage? Do you have any idea?
Sorry, how many licensees are supporting which bill?
It's I'm sorry, doctor degree, yeah.
Oh, the 2680, 2668. How many organizations are supporting that one at the moment? Is that your question?
Yes.
Yes.
And also how many, do you have any numbers that supporting letters?
Yes, let me pull that up right now, just so I can give you an accurate number of the support letters that we have for this bill. So right now we have 6 organizations that have signed on in support of AB 2668. I have not uploaded those letters officially to the state portal yet because the bill has not been set for a hearing. So I'm just waiting for the bill to be assigned to the respective committee staff before I start sending letters in officially. But that's the tentative number of support from organization letters that we have at the moment.
Thank you.
All right. We're not taking public comment at the moment.
The end. Sorry. Back to the members.
Okay. Thank you again for so many years we don't see the many. I in the board since 2000, we have not seen any bill introduced by the profession. So things happening and the profession pay attention to that and not just talk to board. Oftentimes before I heard stakeholder comes to board, we want to do this, so maybe board can do, but board does not have that right to do. Board job is to protect the public, and if the bill, we see the bill is good for protect the public interest, we and workable, viable, then board may take support position. So I have one question about the number. Can you go back to very first beginning? I think the second page of your.
Moderator, thank you, moderator.
So about the hour.
More forward. Further forward. One more?
More.
Again? More?
So I remember the number.
I think we're looking for slide 11.
Okay, so 33, 91, 35, 85. There, I guess one number, one is for master degree, one is for a PD doctor degree. You put the two doctor degree. I don't know how do you differentiate it?
I'm sorry, I'm slightly
Not
confused.
here.
Oh,
Remember, you have a slide, the last two lines, you said the doctor and the acupuncture and the herbal medicine.
Yep. I think two more slides down, slide 13 is
Oh,
where
okay.
it says that.
Yeah, this is the one. So I want to make sure why you have two doctor program around. I guess the first is a master program around the 3391 hours. I guess.
My understanding is that the doctoral programs around 3391 hours are for students who chose to not do the herbal medicine part and just chose to do the acupuncture part.
So that's not in California, because California require acupuncture and herbal medicine both. So I don't see you define. You said a doctoral program around the 3391 hour. What kind of doctoral program, please?
With your permission, I'm going to turn it over to Dr. Yang quickly. I think she may be able to answer this question better than I can if she is still
Sure.
on the
Thank you.
if she is still on the call.
Yes.
Hello, my name is Lin Yang. I'm the past former president of the CAC. So I'm not currently a board member. So I want to correct that on the slides. There was error. I'm happy to answer the question. So this slide just to give an example that in California, existing approved programs include a doctoral program around 3,391 hours. I understand it's the doctor of acupuncture, not a doctor acupuncture of herbal medicine. And then the doctor of acupuncture and herbal medicine program, they offered around 3,458 hours. Thank you.
Okay, thank you for your answer. I think I remember long time ago, we received some information from CAC, and I think there should be master program around because California master program, doctor program, both have herbal medicine, and all approved school maybe our website lists all the schools for even approved school from out of the state. So maybe that's a number put together, including other out of state schools. I just want to clarify to confirm with you. So sounds more, but because only acupuncture program does not in line with California's education. So my understanding is 3391 is the average hour of all the master degree program. And the 3455 hours is the hour for entry-level doctor. So which is, looks the number 3,300 hour. It is the existing education hour is higher than the bill. So is that a lower the requirement of the education?
I understand
I mean, so why is 3,300 hour?
Hold on, I understand that I'm sorry, that some of the programs are out of state. I think you're right. And the average of masters is around 3,000. I have to, I think Ben probably can better answer that question, whether the average 3,000 average master's program is around 3,391 hours.
Okay, it's okay. I just saw the number is higher than the bill introduced as 3,300, and of course, California master degree, the minimum is 3,000, and here there's a PD program minimum 3,300. So it looks 3,300 is lower than the existing program hours. So
Sorry,
I heard.
just to clarify, are you asking how we decided on raising the number of hours required from 3,000 to 300
Yeah.
3,300
So
hours?
yeah, that's a question.
Okay.
You said it raising, but actually it's lowering than the average, not a raising. I mean, the minimum. So look at the number, the three numbers is existing number is high. The average number is higher than your bill. So you said raising, but actually it's lower. How do you explain why 3,300 hour? How did it came out? What's your understanding of this number? I mean,
So
help us to understand.
okay, so thank you for the question. And the reason we set this, it's the minimum hours for entry level professional doctoral degree, and the schools are free to choose offer any programs that are beyond these hours. So in this way, we give the school a flexibility, and also that there are, I think the couple of schools, the hours is only 3,300, like 80 hours. It's a little bit like higher than the 3,300 hours. So we feel that setting this number would help the school better transitioning to doctoral entry level requirement. Thank you.
Thank you for your answer. So that's very clear. The minimum for 3,300 hour. Do you have also this? Have you done any research or investigation statistics for the schools? So I understand that the average for the master degree 3,390 hour. Some school only maybe 24 or 50 hour above the 3,000 hour minimum for the master degree requirement. But obviously, some school goes way higher than 3,000 hour master degree requirement. So do we have a statistic like the schools provide less, just a little barely more than 3,000 hour, and a school like 3,500 hour, those school maybe 400 hour difference, and in between these two category, which school has more students? School has less hour education, and school has more hour education is voluntary. It's not bother mandate.
We
I mean,
have. I'm sorry.
go ahead, please.
So currently, the 13 out of 15 acupuncture schools who offer the professional degrees, they have hours above 3,300, and there are two schools I understand religious schools currently not offer professional doctor degree. And the students who go to these two schools are funded by the religious community, so they don't need to borrow the student loan to get into this program. And in terms of which school has the highest number of students, we are at this moment we are unable to provide them data because there's difficulty to get that kind of data. And but the programs that excel or the programs that would stand out of all professional degrees usually attract a larger number of students just because when the students graduated from this kind of school, it speaks the name of the school speaks the volume because of the quality of the education they provide. Thank you.
Okay, thank you. That makes sense. Quality of the education. So we have, I think, so we have a school representative here. I think at least I know 1, 2, 3, 4 school. That gentleman have not greeting yet. You from school? No. So we have 4 school here. Can you tell us, since the CAC has not had number, how many hours of a master's degree education program in your school? No, that doesn't count. Just a single question, single answer. Just to help them to understand. Because they support the bill, they need to understand. Oh, okay. So how about 5 branch? For master degree? Okay. Well, look at website, but website, yeah. Yeah. Okay. I didn't kind of remember those hours, but I don't. How about SU? Sometimes not updated, probably not necessarily report to the board. That's a problem. Okay. 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 I just met the SCU. Do you have number? So as I remember, if I'm not wrong, 5 branch has 34, 35 hours. For right? For master and a doctor, that's the number on the CB website. And I asked the student in your school, I said, because she has a 4-year bachelor degree, but she enrolled in master degree. I said, why? She said, I don't know. What's the difference? She said, the same hours for PD. Yeah, that's what it showed on. If it's different, and we trust your number, please give us the correct number. I just asked what's their education in Acupuncture school number. Okay, so give us the update. So okay, not a problem. That's why the number is a mystery actually sometimes. So that's another thing that's process. So Yusung University, as I read, remember the master degree is 3360 hour. Am I correct? Okay, when? Not up to, a board does not do any up to. Always something new we learn, right? That's why the meeting is meaningful, fruitful. So that's why you said, just like a website, it's not in the real. So we need to learn from time to time, all the time, from each other. Not
almost there.
public comment, almost there. So I don't have more questions. I just curious about these numbers. Okay.
It looks like one of the presenters, Dr. Anyork Lee, has his hand up. I'm not sure if the the coalition would like to provide more.
Yeah, Dr. Lee, you can speak.
Can you hear me?
Yes.
Okay.
Little louder.
I don't
please.
want to repeat what we have discussed. I'm York Lee. I've been in the board. I've been practicing in California for over 40 years. I think the point of this education bill, Ryan already pointed out, in addition to the prior benefit, the prior consideration, that will also help the acupuncturists get into the research. As a practitioner, when the patient call me Mr. Lee or Dr. Lee, what's the difference? When they call Dr. Lee, that means my education focus on critical thinking, analytical skill, and the ability to engage with complex ideas, which are valuable in any profession. Also, when people consider me as a doctor practitioner, now they also know I was encouraged in personal growth, a broader prosperity through exposure to diverse ideas and culture, and promote social responsibility. Finally, the degree also makes people recognize me as a university education seek to equip individuals to contribute meaningful to society and to adapt to a rapidly changing world. What the change world facing acupuncture? Like Kaiser, not only refer pain case to acupuncturists now, Kaiser begin to refer post-cancer treatment side effect for acupuncture benefit. Also, the Orthopedic Surgeons Association, they already recognize after surgical, if the patient still have the pain, refer to acupuncture. These are all changing environment. Besides that, the newly increasing illness like attention deficit disease, and the research already find out acupuncture will be a potential and beneficial to treat the patient. So the doctor program not just increase our hour, also make the public as a practitioner, make the public recognize as a university education person, not just Mr. Lee as a technician to do the pain relief. So I like the board consider the total picture in one, not just the hour. I think some oppose the hour is because they don't want to increase the student education cost. Even increase the cost, consider the average of 3,000 hours for the current time. It's only 10% hour increase. It's only 10% increase in the education cost. Consider the benefit to increase the critical thinking, to increase the practitioner's ability to serve the public. It is still worthwhile. So I, as a practitioner, and I fully support my association also in the list to support this education bill. And so that's I want to share with board and the public so far. Is there any other comment coming out? I will raise my hand. Thank you.
Thank you, Dr. Lee. Is that all CAC want to present?
So, may I speak, madam? I misunderstood your question. I thought you were asking which program attracts the most student, but your question was actually asking about hours of the PD program. Is that correct?
Right.
Okay, so I do have the hours of the PD program. I'm not going to read through all of it, but I want to give you the maximum. The maximum hours for PT program is 3,555, and the minimum. I'm sorry. So there's University of Bridgeport Acupuncture Institute. Actually, they have the highest, 3,922 hours. And the lowest is 3,385 hours.
Okay, thank you for the additional information.
And I do, if it's possible, I do want to address gainful employment, because in one of our slides we said it will improve gainful employment rate, and I want to address it a little bit further. So as we learned that a gainful employment rate is measured by the debt to income ratio 3 to 4 years after the students graduate. And acupuncturists most of the acupuncturists are self-employed. So it takes 3 to 5 years for them to build up the clientele, and then they will see the increase of income. And this GE metric obviously is flawed, and it has a detrimental effect on many professions, not just acupuncturists. And although it's in the statute already, but we can still change that the statute. I hope the CCOM, because it's a probably largest institution organization for all the schools, and they have a lobbyist, and it's a very good thing. Make a good use of your lobbyists and their ability to lobby the Congress or education department to change that metrics. So if we can work on that, that'll help this profession. And another thing is our bill can prepare the students to receive, let's say we increased the clinic hours by 130 hours, and this last 130 hours, we can structure it in a way that to set up our students to finish that clinic hours in medical facilities, hospitals, and so they can this way it can help them transitioning, working in that environment, increase the employment. In that way, they can, when they graduate, they can get hired by the hospitals and the major medical facilities right away, and it will change. It will significantly change the gainful employment rate in very fast. So I just want to point it out. And besides, our proposed bill effective day is 2032. So our bill does not affect gainful employment for acupuncture schools negatively. I just want to point it out. Thank you so much.
Thank you very much for all the additional input. Any more questions?
Okay. I'd like to make a comment on this background for AB 2668. know there are, this is a new trend that a lot of other healthcare professionals want to put doctorate degree in their name. For example, physical therapist, they studied their doctorate degree. So some of the old timers or who are already established, they don't need doctorate, they don't go for it. But some of them they have the option to do it. Even physician assistants nowadays want to pursue doctor, call themselves a doctor. But this one is, I guess we need to more thorough investigation and research on the hours versus this program. Whoever go through this program can call themselves a doctor. So I would suggest we could use some subject matter experts' advice on this matter. Until then, maybe the board doesn't have much of information or cannot make some decision on this.
Thank you. So, okay. If you don't have any more to add, then we go to next presentation.
Thank you to the coalition for their presentation. If we can have the presentation from CSOMA.
This is the moderator. I'm not aware of any presentation from CSOMA.
Hello, moderator.
Item 5.
D.
Sorry for that.
There are no slides for CSOMA's presentation.
Yeah. The lights on. Good afternoon. I'm Dr. Julie Tran, president of CSOMA. I'd like to take the opportunity to thank the board, staff, and all the stakeholders and everyone on WebEx for allowing me to present our association update. So the main driver of our association, CSOMA, is to protect and advance the profession of acupuncture in the state of California. And we do that through three main kind of outreaches that we do. The first one is advocacy. So we work with our stakeholders. We routinely monitor bills that are being introduced that affect the profession so that we can advise on whether or not we support, oppose, or are neutral to those bills because it relates to and protects our profession. So with that, the bills that have been presented by the CAC, thank you. We are in support of SB 944, in support of AB 1949, but we oppose AB 2647, which is the PT bill, and we also oppose AB 2668 for other various reasons. Not only do we oppose AB 6228, students oppose AB 6268 also. There is a student petition going around and it has over 225 signatures from students from all the various schools. We have submitted that to the legislature yesterday. Our executive director, Dr. Robin Adcock, and our board member, Dr. Robert Hoffman, took meetings in support of SB 944, but also drafted the letter, and you have the handout on our opposition to AB 2668. The other main component that we do is collaboration. CSOMA was one of the co-founders of the CAC. We worked with them on the Medi-Cal benefits of acupuncture not to be taken from the California budget. So that was great on that one. We also worked with the Department of Public Health from the city of San Francisco. They reached out to us because they are hiring 4 acupuncturists to work in their city clinics, and they wanted our advice on what the pay structure should be and how do they make it enticing for acupuncturists to apply for those positions. So we helped with that. The other part is we build community and education. We build community via education through our monthly webinars that are free if you don't need CEs, but they're the second Tuesday of every month. We also are doing our town halls to inform the public of our dealings with legislature, what's going on in the profession, what's coming down the pike. We also have our May conference at Yosan University, May 1st and 2nd, so we encourage everyone to come. We also are having our September conference in Oakland, September 24th and 25th. So all of those build community. We build through education. We try and pride ourselves in providing low-cost CEs to all of our practitioners so that they can continue serving their community and their patients. And that's all I have. Thank you.
Maybe you want to sit, Dr. Chen? Could you please come back? Just easy to hear the board ask question. Thank you. Okay. Again.
You're based in Northern California?
Yes.
And then do you know how many signatures were collected from Northern and versus Southern California?
The student signatures, 225, a majority are from Yosan University, Pacific College, Dongguk, and we are disseminating across all the other states. We haven't heard back from the other schools yet.
So not much from the Northern California?
We do have some schools from Northern California, but the majority are from the schools I listed so far. I'm still waiting to hear back an update from our student board member who's in charge of the petition.
You are based in Northern California?
Yes.
Thank you. No, you're very, that does not create any questions. Save us time. Thank you so much for the presentation and your effort, your collaboration effort with the other association and the San Francisco Department of Health, right? The hiring, that's very exciting, very encouraging. So do they have a requirement for that's okay? Sorry, I said no question.
Yes, they actually already had the job posting. They just wanted our advice on how to make it enticing and what the pay should be, like to be fair, because they do offer benefits, right? And what is the what's the good pay for that? So they have to.
That's not my question. My question is, what's the qualification to be working at Department of Public Health of San Francisco? I remember San Francisco City and the county, they both hire, they only hire 4 of them?
They only have the budget for 4.
Oh, okay. Full-time or part-time?
I believe it is part-time, but the acupuncturist will go between the different clinics that the city has.
I can't recall, they have 15 clinic.
At the time they said they're only hiring 4. I don't know how many clinics they have, but the acupuncturists are rotating between those clinics.
Oh, do you know their payment?
Well, we suggested something, so they would have to, whether or not they took our advice or not. They did take some of our advice, but that's on whatever their pay scale is for the city of San Francisco.
And then what's their tasks?
So treatment of, pain, whatever else they need, the patient needs in the clinic.
So what's the documentation requirement?
I'm sorry, the what?
Documentation.
Oh, they have to do all their regular SOAP notes and everything. They have to be a licensed acupuncturist in the state of California to qualify.
So any requirement like how many years you practice or your education qualification?
That I would not know. You would have to ask the city of San Francisco. They're the ones that listed that. We were just advising on the pay, right? Okay. And how to make it attractive. So it is whatever their requirement is for the city of San Francisco.
The payment is most important. You got to keep on. So I can remember they have some very high requirements. Like you have to be like a primary care physician's level to know all the knowledges to diagnosis. So that's not every acupuncture can be qualified. So maybe they try out for maybe later on they saw perform well and not too expensive, they will hire more.
Yeah, that we hope that that is a step in the right direction so that more acupuncturists will be integrated into more city systems, state systems, national systems.
Does Sisoma has had any effort involved with this hiring? Like, I mean, not you help the hiring, but before the hiring, did you help them to develop this idea concept?
They already had acupuncturists working for them.
I see.
I think they just expanded it with the work of the acupuncturists who were already working for them. They expanded the program with their input.
Right.
And then the recruiter for the Department of Health, Public Health from the City of San Francisco reached out to us to ask us, we want to hire more. Does this seem about right for the pay scale?
Okay.
And so through talking with myself and our executive director, Dr. Robin Adcock, we said, okay, this is what we compared it to what UCSF pays their acupuncturists. And we said, this is about where you should be along with benefits. But again, that's City of San Francisco has the final decision on that.
Okay, so maybe Sisoma can advocate for this acupuncture profession with more department, like a Department of Veteran. They only hire 170 acupuncturists nationwide, while they need a lot of acupuncturists, but actually were not in their system in enough number. Maybe Sisoma can do that. Advocating will be good for your members.
That is one of our driving forces, again, advocating and advancing the profession in the state of California, also trying to open up more job opportunities for acupuncturists, because not every acupuncturist wants to be in private practice, right? A lot of acupuncturists either want to do the QME or they want to work in the hospital system, but in order to do so, we need one standard, because when you look at the hospital systems like the VA hospital and things, the only requirement is that you hold an acupuncture license and you're nationally certified, that you've taken the national exam. It does not say that you have to be a doctorate. It does not. It's some say preferred, but it's not a requirement, right? So to open up acupuncturists, right, to be able to work in the hospital system, it's better to have one standard. And that is why CSOMA back in 2018 introduced a bill for the CAB to adopt the national exam. So it was either or to get licensure in the state of California, so that it would be easier for acupuncturists at the time to get into the hospital systems, because on the national level, they only care about national certification, that you have your NCCOM or NCA, whatever they change their acronym to be, right? They don't care that your license, you passed the KL or not. They only care that you have your license and that you're nationally certified, and that you don't necessarily have to have a doctorate. It's as long as you're a licensed acupuncturist, you've did your time, you can apply to be there. So that's why we oppose AB 2668, because that puts undue burden on students, current students, and future students for increased hours, because you're looking at 300 hours. That's, according to what we researched, that's another additional year of education. That means it's an additional year of studying without earning income. And then that income to debt ratio when you get out is even going to be more over the life of that loan. So we're opposed to that. And so are the students. As you can see, the petition will be submitted, and there are more signatures coming.
Yeah, so I think you remind all the histories. I think partially that's the once a while that was a history, but later on, KIO added on to national examination. That was 2018 when Katama was functioning active, wrote a letter to Medicare to ask them, California has own exam, so they added on. KIO is qualified to the Medicare as well. So yeah, that's the case.
Right.
So I think you talked half, but the later another half is also in the place
Right.
later.
We need to
Yeah.
have acupuncturists listed as Medicare providers. That's a change of the law.
Yeah, so
We're
because
working towards that.
California, it is unthinkable. Exclude California's acupuncture is because not everybody has a national exam certificate. Yeah, so California has a higher education, higher education, and no reason to.
Right. Well,
so
and that's
they
why when
more because they did not know. So
Right.
if I may be far away from Washington D.C., they didn't know. Anyway,
Right, and that's why when we introduced the bill, we asked for the board consider adopting the national exam also, but it was a either or. If you take the KL or national, you would still get licensure in the state of California.
Yeah.
That was part of the bill.
Yeah, I remember. Understand your position. So just extend the question. Does Sistema has any plan to help acupuncture to qualify? I mean, the degree education is one thing, but the real competency is another thing. To when the hospital, I just say, if one day all the hospitals, medical center, they open to acupuncture because you're advocating and other associates are advocating, and acupuncture is ready to be primary care doctor, primary care provider. That is very high requirement. California's acupuncture is considered by law primary care. We can do diagnosis, some diagnosis, not the difficult diagnosis. So basic diagnosis. So we can have different by the legal to enter. That's my understanding. Primary care can do diagnosis. So I hope Sistema will grow and do more job, help the profession. Thank you.
Yep, thank you.
Okay, let's next. Next is public. Do we? Okay, already there. Please, yes. Health, right? Public comment. You can sit down, please. You wait all morning, all afternoon.
This is the moderator. If someone is speaking, we are not hearing the people that are
Sorry,
logged.
that was me. We're going to do
Okay.
3 minutes for public comment for everyone on this item.
Okay, thank you.
Is the light on? Not hearing anything on one.
Right. Oh, how there we go. Hey. So for the people online that just missed that, I wanted to acknowledge the fact that Neil Miller has passed and he is not here with us at this meeting, and his advocacy for the profession will be deeply missed. And I have vowed to Ben Badea that I will channel his inner fire. So I'm sorry ahead of time. For those online, my name is Robert Hoffman. I'm the president and CEO of Yosan University of Traditional Chinese Medicine. I have both a master's and doctoral degree in Chinese medicine and have served as vice chair of ACOM, a board member for CSOMA, and currently a consultant for the European accreditation standards with the ECTCMA. I've also spent the last 3 years on the standards committee at ACOM, rewriting the standards for both the master's and doctoral program, meeting every other week with Jason Wright and members of that committee who are made up of ACOM members and members of the CCAHM. So I spend a lot of time in standards. I'm also very thankful to Jason and Mark at ACOM for making the elephant in the room so clear. Within the next few months, federal financial aid is drastically changing. Loan caps are tightening, Grad Plus is being eliminated, and gainful employment reporting is tightening the noose on our profession. Multiple analysis are already warning that almost all acupuncture programs will lose access to federal aid within the next 2 years. If that happens, students will not be able to finance the programs as they exist today. So bringing up the numbers that we have right now is unfortunately pointless because those programs are not viable. When students can't afford and cannot access financial aid, they do not enroll, programs shrink, and they will close. That's the environment we're operating in today, and that's kind of the context of where this whole conversation should be. As has been mentioned, our accredited master's and doctoral programs already exceed ACOM's required hours, so mandating these hours at the state level adds no value. It will lock in cost, remove flexibility, and as you all know, once it's written into statute, that becomes very difficult to change. We will be back here in a year or two with the exact same problems and actually have fewer options. So the evidence across higher education is very clear. Increasing program length and cost without demonstrated outcome improvements reduces enrollment and will constrain our workforce supply. So we have to be clear about the timing. If we increase hours now, we're increasing cost at the exact moment students are losing the ability to pay. A 10% increase in hours is not just a 10% tuition cost. There's loss of income while the student is in the program. There's the time away from family and friends and jobs and self-health, self-care. And that interest will be compounded if they have financial aid. That interest could be compounded over 10 or 25 years. So a 10% cost, average master's cost, average doctoral cost in California, what are they, 3,500 hours, about $76,000. 10% cost, $7,000 over the 4-year program. That could turn to $10, $12, or $15,000 over the cost of a loan. So it's not that one-time hit. At the same time, U.S. Department of Education is moving towards stricter outcomes-based accountability. Programs are being evaluated not by how many hours students complete, but whether students can earn enough money to justify the cost of their education. So this creates a real contradiction for us. The state—
30 seconds.
Thank you. The state can mandate more education, but it cannot mandate higher earnings. As you can tell, I'm deeply passionate about this. I'm very upset, actually. And unfortunately, the argument for 2668 is filled with misunderstanding, misinformation, and contradiction. We have to recognize the environment we're in, or we will close schools. We will lose practitioners in the state of California, and we will fall behind the rest of the nation in healthcare. Thank you.
So, dear board member, and I'm so happy to be here. After the few hours of listening that I talk it brief, and I really agree what Dr. Lee talked briefly and what the main point why we need to pushing this bill. The history, you know, I'm the president of American Alliance Acupuncture. Also, I'm the president of American, actually it's the Council of Acupuncture and Oriental Medicine Association, KOMA. So this is an organization, 40 years, this year is a celebration. And so important, I want to educate the board member, you maybe never know, California up to today is already 50 years, the legalization from acupuncture. It's a long way, but we have been go to a very, very difficult, but actually it's a Victoria Day role, okay? The reason why I say that, in California, after the 50 years and the 40-year KOMA is a sponsor of many bills, over about hundreds. Now we're doing the Medicare bill, we are the sponsor too. American Alliance is already working 33 years. And now I go to Congress every month in working in Congress inside to serve the member and their staff using acupuncture. Why? Because the bill 6 years ago already passed inside the Medicare already. And people waiting, 70,000, 70 million of the elderly waiting for it. And President Trump signed that on 2000 and then 2020. Now 6 years, why we still have to work hard on it? Because we can see the big picture. Once the Medicare, the bill we pass as a qualified acupuncture into the provider, physician, or health provider they call, then we can serve 70,000 of the patient, elderly. Think about this number, and we're thinking about California. We already is the leading state of the profession. We work hard. So after listening to all the school, the concern, ACOM, I haven't heard the CCOM yet, okay? I just want to mention that we are a team.
30
We're
seconds.
not try to fight with each other, okay? Try to work on it. Look at the chart here. This year, 2025, only 150 students to go to take the test, right? And then pass is only consider like 54%. So small amount of the student, why? Then we have to think about our education. We think about not the quantity hour, it's the quality of the education. So that's why we can, working with other school in the future, we can think about, we are not just like say opposing or agree. We have to working as a team. How
Time
we
is
can
up.
improve our California education to be a leading of the whole country, to serve all the people in the whole United States. And education is the most important thing. That's my concern. Thank you.
Thank you. Sorry, we open online Webex, 2 of them, okay? They are waiting too. So we open for 2 comments. Please, moderator, thank you.
All right, we have several raised hands in WebEx. We'll start with Farshid Naman. Farshid, you should see a prompt to unmute. Go ahead and click on that.
Thank you so much. Can you hear me?
Yes.
Thank you so much. I'm Farshid Namin. I'm MD grad, UAM, and faculty member of the Houston University. I'm also want to second Dr. Hoffman talking about the Mr. Neil Miller, our friend, which always in the California Acupuncture Board, and we miss him, of course. My topic is about the first presentation we had today about the Council of Colleges, and I want to object to adoption of the CNT, this version of the CNT in California. The reason is that because the CNT manual right now, it's included so many outdated information and also so many aspects about the medical and also safety procedure are missing. And this is very serious issue, which is this manual has lots of shortages in their context. I contacted several times with the Council of Colleges. I had the opportunity to talk directly to the president of the Council of Colleges. It seems that they are reluctant to do any improvement, and they even do not hearing our concern. So the point is that my objection and the other objection, which I want to make it clear for the California Acupuncture Board, is that basically, because since it is discussed in the California Acupuncture Board meeting, is that CNT is considered as a main money-generating, revenue-generating tool for the Council of Colleges. Apparently, 73% of the Council of College revenue comes from the CNT, and only 14% of the revenue. It seems that 40% of the revenue of the Council of College is only comes from the membership, and the membership is shrinking. I heard that 32 acupuncture schools also member of the Council of Colleges out of 50. It seems that almost like 35 to 40% of the acupuncture school do not renew their membership with the Council of Colleges, and they have to ask themselves why. So maybe because of their performance. But my point is that mandating California schools for the CNT, especially this version, which is lacking so many of the basic information needed for the safety of the patients, very important for the practitioners, is missing. And I highly recommending
30
not
seconds.
adapting this version of the CNT in California. Thank you so much for the opportunity.
All right. Our next
Thank
comment
you.
is from,
Okay, sure.
our next comment is from Lynn Yane. And Lynn, you should see a prompt to unmute yourself. All right, Lynn Yane, try unmuting yourself again.
Okay, can you hear me?
Yes.
Okay, thank you. For the education, the expenses increased hours. I understand that in current acupuncture legislation allows tutorial program because the tutorial programs is designed purposely to reduce the tuition burdens while offering flexible scheduling for individuals who cannot manage both college classes and their work schedule. So that could help the students to finish the program. And it's very good design. And secondly, the creation of acupuncture assistant position can provide opportunities for students to gain experience and financial support while pursuing their education, acupuncture education. So it's another way to help the students to get through the education. The third way is students can complete up to 350 hours of foundational science coursework at a college, at a community college, where tuition costs are significantly lower, and with these hours counting toward the total program requirements. So currently there are three ways to help the acupuncture students to finish the program and to reduce their financial burden. I just think that in our system, acupuncture education system, we provide more ways to help the students than other programs, even though students get less loan. In terms of the education standard, ultimately, strengthening education standard is essential to safeguarding the future and the integrity of this profession. Lowering standards, by contrast, risks undermine.
30 seconds.
And when we talk about the injuries from dry needling, recently there is high profile athletic players sustained collapsed lungs by dry needling. It's a wake up call to us that we cannot lower our education requirement. Every life matters, even though the injury rate for acupuncture is extremely low. And according to my research, the injury rate is 0.024%. But a human life is not a status.
I'm sorry, your time is up. Sorry. The next speaker is AACMA.
Moderator, we're going to stop right there and switch back to the room. We're taking
Okay.
2 and 2.
Oh, okay. Thank you for that.
Thank you, everyone. Thank you, board. Can you hear me? Okay. My name is Yeah, the lights is on. My name is Gina. I'm from Five Branches University. Just want to say that at this moment that we are not in the support position for the AB 2668 for education increasing hours to 3,300. Like Dr. Lau said, quality and quantity, it doesn't mean that you keep on increasing the hours and you are increasing the quality of the education. I think the quality of education, how we ensure that our programs are teaching the right information and training them to be capable to become a practitioner, either in a private practice or in a system-based medicine practice. So, and also and currently, California is already at the highest among all the states. And our professional doctor program, we've been teaching professional doctor program for the past 9 years. And our program is already higher than the ACOM standard, just because of to meeting the California requirements, and we're adding more hours to meet the ACOM requirements. So I think at this moment, the California already has the highest standard for practitioners. And also currently, our students with the masters, the graduate, that they get licensed, and when they are also, when they're licensed, they are practicing, and they can also continue their education into the doctoral level, the PT program, or even the postdoctoral, the DL1 program. I think that gave them a path for them to be able to financially sustain and improve their practice at the same time. So just my comments. Thank you.
Thank you. And then we can have another stakeholder from the room. Opportunities. The comments should focusing on the 4 presentations. Okay.
Hello, my name is Jingjing Shi. I'm the founder of TCM AI platform. I think the question about quantity and quality, hours, I think I fully understand both sides. Now, I would like to propose a possibility. AI is here. AI is a super tool. We have an AI platform that made 136 national masters, grandmasters into AI platform, which the students can use in their spare time, right? You don't have to increase the hours of tuition, because and the students discuss among themselves. So AI is a super tool for education and a super tool for as a doctor's assistant. So I think we should embrace AI. It's inevitable, right? It's here, and it's going to be even more powerfully transforming every sector. And in the life science, I've been doing healthcare cross-border collaboration from US, Europe, and Asia for 32 years. And doing venture capital funds and actually as attorney in charge of healthcare in my former life. So I fully understand how can we accommodate the needs and hearing the needs of different stakeholders from different angles. But importantly is, do we have a solution? And I think technologies probably is one of the major factor, particularly in California. We are the epicenter of AI. And we should understand how this would help us. So I just posed that question. I'll be happy to share our platform if anybody interested. We in the last 2 weeks, we have signed up 230 acupuncturists and doctors in Northern California alone. We're going to start training for 2 hours. You can use it next Tuesday. So
30
welcome
seconds.
to see as a tool for students and also as a super tool for our doctors of continual on-job continual education. Thank you.
Thank you very much. That's something new. So we are AI, no, heard about AI, but seems AI is coming to acupuncture profession. Maybe this another challenge or opportunity. So we'll see in the profession. Anyway, to back to the WebEx comments. Moderator, please open the mic.
Thank you. Our next comment is from AACMA, and AACMA, you should see a request to unmute. We'll try that a second time.
Hello.
Yes, we can hear you.
Oh, thank you. Okay. My name is Jin Jiao Xia. I'm presenting for AACMA. For over two decades, we can see our profession advancement hitting the plateau. Our school having difficulty in recruiting new students. Some of the schools are closing down. Many of our new graduates have difficulty in opening new successful practice. Many existing practice have very slow business based on CAB's occupational analysis. We believe all these problems are most because of the low quality of education. Our education needs to catch up, so AACMA support the effort of reform and increase the quality of acupuncture education in California, including adoption of PD. We urge our communities to discuss and reach consensus on this matter. And we believe that elevating education quality is not necessarily increasing the cost, but it does need a lot of work, and it will be benefit public, future practitioners, and schools. Thank you.
Thank you. Dr. Xia, right? So one more from WebEx, please.
Thank you. The next request for comment is from Dominica Zhao or Zhu. Dominica, you should see a request to unmute.
Good afternoon, members of the board. My name is Dominica. I stand before you in a dual capacity as a student currently training to enter this profession and a daughter of its history. First, I want to express my gratitude to this board for the work you have done to help elevate and standardize this profession. I am here today to advocate for the elder pioneers who risk being phased out by certain regulations. My mother is one of these stewards. Having survived war and famine in China, she was part of a generation that protected the lineage of traditional Chinese medicine during times of immense national upheaval. She represents an indigenous lineage of practitioners who mastered this medicine through high-level traditional apprenticeship, long before our modern institutional standards were codified in the West. And for nearly 50 years, my mother has practiced with clinical excellence. She was among the first 300 practitioners licensed in both New York and Florida, two states known for their rigorous standards. And she has treated hundreds of thousands of patients and helped build the foundation of respect that we stand on today. But despite this half a century of mastery, her acupuncture practice is currently on pause since moving to California. Because her traditional schooling and apprenticeship predate modern standardized formats, the California licensing requirements functionally ignores her lifetime of expertise, requiring a 75-plus-year-old pioneer to repeat many basic academic requirements of a student. We must recognize the gravity of what we are asking. To require a 75-plus-year-old master who has already practiced for almost 5 decades to start over from the beginning simply because they moved across the state line is more than a mismatch of assessment. It's a profound professional indignity. At this stage of life, after a lifetime of service, the barrier of re-entering a student-level academic environment and navigating linguistic hurdles in standardized testing does not reflect their actual medical knowledge or proven ability to heal and poses severe undue burden. We cannot truly honor this medicine if we do not include a seat at the table for the pioneers who carried this medicine before it was standardized in the West. I'm here to respectfully request that this board prioritize the creation of an accessible pathway for these elder practitioners to achieve licensure in California. Those with decades of practice and licensure in other highly regulated states, recognizing that as this generation of pioneers grows older, we face a critical and final window of time to integrate their mastery before this living library of wisdom is lost to us forever. Thank you for your time and your leadership.
All right, and back to the room.
Okay, thank you, moderator. So back to the room. I have two opportunity. So we give opportunity to the stakeholder in the room has not talked, and you want to talk.
Seeing none.
Okay, see now? Okay, then go back to WebEx, please.
Thank you. Our next comment is from Lillian Lee. Lillian, you should see a prompt to unmute yourself.
Can you hear me now?
Yes, we can.
Oh, okay. My name is Lillian Lee. I'm the academic dean of Alhambra Medical University. I'm so grateful for board leading this meeting with ACOM, with CCAHM, all those kind of organizations and associations. I think it's very wonderful we sit together to talk about our future. From the whole morning and now, actually, we look at the future of acupuncture and herbal medicine education. We are truly asking a central question. How do we position our profession to thrive within the modern healthcare system while remaining attractive to the next generation of students? So we need to think about the student-centered thinking and also think about our professional centered thinking. So we are facing the problem right now. It's a school closure, financial cutting, and a lot of other things, right? But what's the key root of this problem? We learn TCM, there is a superficial symptoms, and we need to find out the root. The root is actually to raise the licensure standards in order to advance this profession. So actually, look at those other profession, healthcare profession, PTs, pharmacies, chiropractors, and MDs. Their pathway should be after they get the doctorate degree, after they get the doctorate degree, and then can take the exam, the board exam to get their license. But for our acupuncturists, we get the master can for public imaging already lower than other healthcare provider. So if we solve this root problem, we raise to doctoral entry level to get the license, and then look at the insurance. They will see us as a true doctor. And then look at the students. They were thinking,
30 seconds.
They will compare all the healthcare professional career in their study. So they will come for us. And for other interest groups, once we identify our stance, our posture, and then all the other problem can be solved together. So it's not a problem for future that's you can't have enough enrollment or by the cutting of financial aid. If we don't change the entry level to get the license, I think that's the problem. Thank you for all.
All right, the next comment is from Dr. Amy Major. And Dr. Amy Major, you should see a prompt to unmute yourself. Go ahead and click on that.
Thank you to the board. Thank you, members of the board, for your commitment to raising this profession. Please know, my name is Dr. Amy Major, DACM. I was first licensed in California when I attended ACTCM, and I'm a direct student of Dr. Miriam Lee. I've been practicing for over 35 years, and I am the Federal Advocacy Chair of the American Society of Acupuncturists. I'm a subject matter expert for the National Certification Commission for Acupuncture and Oriental Medicine, now NCBAM, National Commission Board for Acupuncture and Herbal Medicine, on the Foundations of Oriental Medicine Exam Committee, as well as on their State Relations Task Force. I am here to testify on behalf of CSOMA. We were asked to come and testify. They are one of our member state associations in opposition to California AB 2668, as introduced specifically its provision allowing the California board to waive ACOM accreditation requirements for graduates of schools that were denied accreditation or candidacy status. This provision, though perhaps well-intended, poses a serious and far-reaching threat to safety, licensure portability, and the national standing of the profession. When we look at wanting to move states like the previous person testified to, when we have a national standard, then it makes it much easier for all licensed acupuncturists, be they doctors or not, of traditional acupuncture. I also wanted to speak to not increasing standards, because having a clarified national standard matters. Whether or not it's California, the qualified acupuncturist for Medicare. I am our national Medicare lead for the American Society of Acupuncturists, and our lobbyist Holly Strain is working with us every day to work to pass this bill. Licensed acupuncturists already meet in California a rigorous, standardized, verified practice. It's very important that we continue to make sure that we are not increasing the burden on schools and students as we are facing issues with federal funding and loans, and how it will affect students and particularly schools as
30
well.
seconds.
Thank you for your help, time, and skill. And I hope that the efforts of all the students and schools and providers who are in opposite position to this will make a difference. Thank you so much.
Thank you, Dr. Dr. Major.
All right, next we have Lori. Lori, you should see a prompt to unmute yourself. Go ahead and click on that.
Thank you. Members of the board and staff, my name is Dr. Lori Gaitis, and I appreciate the opportunity to comment. I'm very sad that Neil is no longer here to be an advocate to the board and remind us all of our responsibilities to safety and providing access to California citizens in need of our medicine for pain management. I have a master's and doctoral degree from the American Institute of Traditional Chinese Medicine, which closed in 2023 without any response or concern about losing this institution. My education has been sponsored by the California Department of Rehabilitation, an enviable benefit for those people paying off their student loans and for those in the future who will not qualify due to the loss of upcoming funding. I've had 2 externships at the California Pacific Medical Center Rehabilitation Department and the San Francisco Sheriff's Department, their regular program for incarcerated women. I, like many of my colleagues with and without disabilities, have had trouble passing the California acupuncture licensing exam. I've taken it twice at 2 separate PSI centers. The first PSI center, a computer network, crashed when I hit the submit button. In the middle of my second exam at the PSI center, the computer networks were down for 5 minutes. I've passed 3 of the 4 national exams the first time, and I'm now applying for my acupuncture license in Florida as I'm being held back from using my skills I've gained in California. I spoke at the 2018 CAB meeting regarding California's accepting the national certification. I respectfully ask the board to place on the future agenda a formal review of the California acupuncture licensing examination, including its alignment with approved educational curricula, its effect on the entry to the profession, and its impact on the workforce access. I make this request because today's meeting already reflects board's attention to the education to licensure pipeline, but with the One Big Beautiful Bill Act eliminating graduate plus loans and the impact of this on California acupuncture colleges, along with the reduction in total number of California acupuncturists and the low number of graduates passing the California acupuncture licensing examination. The board's own data show that recent first-time pass rates have ranged from 72 to 77%, while overall pass rates have been as low as 61%.
30
When a
seconds.
licensing examination produces this level of attrition among graduates of board-approved programs, the board should ask whether the exam is fairly testing minimum competence in alignment with approved curriculum, or whether it is operating in practice as an avoidable barrier to lawful entry into this profession. Thank you for your attention.
Next, we have a comment from Chad R. Chad R., you should see a request to unmute yourself.
Hello, can you hear me?
Yes.
Oh, great. Well, thank you. And I wanted to introduce myself. My name is Chad, and I'm a disabled veteran, retired, and I've been a supporter of acupuncture for many years. One of the reasons I'm so interested in acupuncture is that several years ago I had a bit of a epiphany. I've been struggling with intense chronic pain for many years, and I went to a acupuncturist who had been trained in China very rigorously, and he was able in 6 visits over a course of 4 months to completely alleviate the pain permanently. Nothing that the VA ever tried, including copious amounts of drugs, even affected the pain, but he was able to do it with a special technique and specialized needles. And what occurred to me is if I had not gone to him and had the opportunity to get treatment from him in particular, I don't think going to a normal acupuncturist would have succeeded, which led me to think that maybe what we need in the acupuncture profession is not reducing it out of fear of the economy or of lack of loans and so forth, but actually increasing our standards and making the education more rigorous. One thing that I have to address very quickly about the lack of student loans that's coming up. One thing that I have learned in my life is that when one door closes, another one always opens. And what we have looking forward is an explosion of the use of AI and the ability of small businesses to jump on the blockchain now that the dollar is being pegged to a stable coin, which means that we will see wealth funds and so forth that are privately owned that will be giving out loans, business loans, student loans at much better rates than the government ever did. We just need to be optimistic about that and stay the course with the quality of education that we want to bring out with acupuncture. I've said this all very quickly, and I hope I've made the point. Thank you for listening.
Thank you very much, sir. Any more from website?
Yes, we've got about 6 more raised hands. We have, excuse me, I'm just looking at the, someone logged in as Ann York at Gmail. Ann York, you should be able to mute yourself. And Ann York at Gmail, if you see a prompt to mute.
Can you hear me?
Yes, we can hear you.
Okay, so I want to clarify when I mention 10% increase in cost, it's based on the statute hours. In fact, most of the California acupuncture school, their training program is already over 3,000, or some even as 5 branch mentioned, they are over 3,300 hours. So 10% increase in tuition cost is just my comment on the statute hour, not in practice. In fact, if you look at all the California schools, they already even equal or over these 3,300 hours. And the program in practice will not increase the current school educational program. Second, we mentioned a singular standard. It's an all program. ACOM or CCOM do not have a national standard program. Then I heard clinical technique request for a singular standard. And if in practice, I already see many comments, yes and no, okay. But I want to point out why the issue still here is there's no national standard for ACOM or CCOM. Each state has their different standard. Finally, I want to point out, education is really belong to the school. In our constitution, there is no even one word mention education. Our president even want to cut the federal education department because education is a local issue, not a central issue. I like the school take the responsibility, work out with the practitioner what is the best way for both sides instead of talk back and forth for so many years. That's my comment.
Thank you, Dr. Lee.
All right, next we have a comment from Anne Liu. Anne, you should see a prompt to unmute yourself.
Hi, can you hear me?
Yes.
Thank you very much, the members of the board, as well as all in attendance today. I deeply appreciate your hard work as well as your earnestness in safeguarding our profession, as well as elevating its standards and strengthening its future outlook. My name is Annie Liu. I am a recent graduate of the National University of Natural Medicine, top of my class. While not technically a California school, actively invested in the California Acupuncture Board as a member school approved to be able to take the acupuncture licensure test in California. As such, I am a prospective California acupuncturist, as well as someone studying and preparing to go to China to further my education. I am no slouch when it comes to educational standards. I would not be investing my time nor my money into going abroad to intensify my education as well as intensifying the roots of my education here in the United States if I were. Yet, I speak today not in support, but in opposition of Bill AB 2668. The reason being is, well, it should be very obvious. Most, if not all, school programs financially are already underwater when it comes to the benchmarks set forth by the current administration, and not just the current administration, but also the Biden era administration when they tried to introduce similar limits to federal funding to schools with given metrics. I am perhaps the one student here who has the least amount of titles, the least amount of accoutrement when it comes to being a part of this profession. I'm aware that perhaps I'm speaking from a place that is seen to be rather small. A student straight out of school, not much exposure, people don't know who I am, and yet I sincerely urge that you hear my voice because it reflects many of the voices that, for example, were on the petition that CSOMA introduced earlier, of which my name is but of one of those several hundred. If I were in the position of being a student and a prospective practitioner of this craft going into this entire situation, and I see what is going on financially, both with the schools
30
in the
seconds.
profession, as well as in the government, I would not put my time or money into going to a school of Chinese or East Asian medicine, just by virtue of the fact that I cannot count on future projected incomes and outcomes when there's already so much debt and so much history financially of this being absolutely impractical. I'm only just going to lay that out there because my time is limited. You can choose whether or not that is a valid statement to make, but I'm speaking from an everyday person standpoint.
I'm sorry, your time is up. Our next comment is from CUSVCA at Gmail. So CUSVA should be able to unmute yourself. All right, we'll try that one more time. Oh, there you go. You're unmuted.
Okay.
We can hear you.
Oh, yeah, this is Philip Yang from CUSV. I've been listening to all the presentations and the comments. My position for about the education is we think that right now California's master's programs over 3,000, and doctor's program only like ACOM's requirements is only 100 more hours is difference. So we increase a little bit, 300 more hours. So we get a doctor's program, the doctor's degree. Then the difference is the training is different. Master's program is for basic training, for basic competencies. And like some of the graduates, they are very busy in their patient record writing, spend a lot of time in the various aspects of the trainings. So they're not specialized in the clinical practice, but some capable students, yes. Then to doctor's program is just a few hundred hours to get specialized in training, like CUSV or a doctor's program specialized in brain diseases, brain sciences. So like every graduate, after they graduate from the program, they can be specialized in treating like migraines and depressions, anxieties, and so many brain-related diseases. At least they are strong in this aspect. And so if every school, every doctor's program specializing in this training, that will definitely increase the reputation and the strength of a whole profession, and not just some of the practitioners. Talking about the incomes, like we this morning have so many statistics about the incomes. The income of every practitioner, especially self-employees, that depends on your effectiveness. If you don't have any effectiveness, no patient want to come over to you, especially for acupuncture treatment. So how you can guarantee you get the effectiveness? That's your real
30
clinical
seconds.
abilities. So this is specialized in training is really necessary, and doctor's program is a necessary process. This is we get a doctor's title instead of just LACs for decades, compared with other professions, OA, dental, PT, chiropractor. They all been in the doctor's degree already. So spend a little bit of money to get a doctor's degree. Why not?
I'm sorry, your time is up. Our next comment is from Christy Vitiello. Christy Vitiello, you should see a prompt to unmute yourself.
Hi, can you hear me?
Yes.
Great. I'm Christy Vitiello. I've been a sole proprietor for 18 years in my own practice, and I'm also on the board of CSOMA. What upsets me the most about this meeting is this meeting should all be about the PTs. This is a bill right now, AB 2668, is taking away what we can do together against the PTs. Because in the end, The amount of education is not going to matter once the PTs get a hold of dry needling. Also, we are an evidence-based practitioners, all of us, and there is no evidence that links, you guys keep using the word recognition, and improves integration nationally. There is no evidence base that has been done that says if we get more hours, which by the way, just a reminder, California has more hours than any other state. So there's no evidence base that says that this will bring us higher and get us more jobs. What gets us more jobs, because I've been in the room with the DoD and the VA, who is in charge of hiring nationally. I've been in those meetings over the years, and the consistent messaging they give is, we do not have a test to regulate you guys. Don't have one national test that covers every single state. Not a single word of them asked for hours to make us qualified as anyone else. And that is the thing that people are not understanding. The people that are presenting this bill have no educational background to give this information, because the problem is the people that are hiring nationally are wanting us to be a group that they can hire over the PTs for acupuncturists. But since we are not nationally certified, the whole problem is that people are going to be able to hire chiropractors and PTs in the VA and such if they get to be dry needlers all throughout the entire states. So I'm very upset that this is the bill that was presented at this time with no evidence base. And also the fact that at this point, we should all be commenting on how to get all together to make sure that dry needling does not go in the scope of physical therapists. Thank you for your time.
Thank you.
All right.
Any more?
3 more. We have Nathan Lara next, and Nathan, you should see a prompt to unmute yourself.
Moderator, we're not going to accept repeat comments.
Okay. Nathan hasn't spoken yet, but I will note of any people trying to repeat.
Thank you.
Can you hear me?
Yes, we can.
Thank you. Good afternoon. My name is Nathan Lara. I'm the Director of Admissions at Yosan University of Traditional Chinese Medicine. Having worked at the admissions department at Pacific College of Health and Science and currently serving as the Director of Admissions at Yosan, as well as studying in the DAC CHM program myself, I've spoken with thousands of prospective students over the course of my career. I speak with them every day. People who are deeply passionate about this profession, but genuinely uncertain whether they can afford to enter it. What we are hearing with AB 2668 is consistent and clear. Students are not deciding between schools. They are deciding whether they can enter this profession at all. Cost, living expenses, and financial aid constraints are the defining factors in that decision, not a lack of commitment and not a lack of passion. Any legislation that increases program length and costs at exactly the moment when financial aid is becoming more constrained does not raise standards, it closes doors. Barriers to admissions are a topic of serious and ongoing conversation in higher education, and this bill in the current financial climate would create exactly those barriers, driving students away from a profession that needs them. If costs rise further, more students will walk away, not because they lack dedication, but because they simply cannot make it work financially. I urge you to consider the student perspective as this debate moves forward. The strength of this profession depends on who we allow in, and right now we cannot afford to make that harder than it already is. Thank you.
Thank you.
All right. Our next comment is from Jenny Yu. Jenny, you should be able to unmute yourself. Jenny, if you see a prompt to unmute yourself, go ahead and click on it.
Yes, moderator, can you hear me?
Yes, we can.
Hi, good afternoon, board and staff members. My name is Jenny Yu. I am the Dean of the College of Eastern Medicine at Southern California University of Health Sciences. I would like to express the support to incorporate CCAHM's CNT, Clean Needle Technique, into California's curriculum for 2 reasons. 1, to standardize training in patient safety and infection control. And 2, risk management and liability reduction. I respectfully ask the board for this consideration as the clean needle technique is essential and extremely important to public and patient safety. Thank you.
Thank you. Dr. Yu.
Okay, our next comment is from Jason Wright. Jason, you should see a prompt to mute yourself.
Thank you. Can you hear me?
Yes.
So as a reminder, I'm ACOM's Director of Accreditation Services. In that regard, I'm not advocating for any of the actions of the California Acupuncture Board or advocating for opposition in any of the topics that are on the agenda right now. But I do think some hard numbers are valuable for the Acupuncture Board to have in your hand as you consider all these topics that you're discussing today. So I've got some numbers for you in terms of program cost, living expenses, debt loads, and how those impact student loan debt. Again, not advocating for or against raising educational standards, but I think it's helpful to understand a lot of what people are referencing in terms of cost. So the master's program ranges in cost from around $62,000 to $120,000 for the entire tuition package. The doctoral program with herbs is comparable to that, $66,000 to $130,000 in terms of total tuition package. When you add that on top of standard cost of living expenses are roughly estimated at around $3,000 a month. I think many of you that live certainly in the Bay Area might say that that's not even close to what might be necessary. That puts you at $36,000 a year for a 4-year program. That would put you at $144,000 for cost of living. So if you're taking cost of living on top of program tuition, you're going to look at your graduates coming out of the programs with somewhere between $200,000 to $300,000 worth of loan debt. Right now, we know that $100,000 is going to be the cap for the graduate loan debt under the new RISE bill. And then we anticipate that by 2028, there won't be any federal financial aid available. So you will be looking at coming up with $200,000 to $300,000 of investment for a student to get through these programs in their entirety with cost of living. The current median earnings that we're seeing that are being part of that earnings threshold metric is showing that currently the master's and doctoral programs, the median earnings are ranging between $20,000 a year to $36,000 a year. And the basic earning threshold for the graduate level programs, whether they're at master's or doctoral programs, are that those earnings thresholds need to exceed approximately $60,000 a year. So just
30 seconds.
Noticing that there's a significant shortfall between 20 to 36,000 and the 60,000 benchmark, and the investment that students are kicking in is somewhere between $200,000 to $300,000. Thank you.
Thank you.
And next we have Maria R. Maria, you should be able to unmute yourself. Maria, we will try that again. If you see a prompt to unmute yourself, go ahead and click on it.
Can you hear me now?
Yes.
Okay, great. I am an acupuncture patient, and I've received weekly treatments for well over a decade, primarily for progressive idiopathic neuropathy. And I have to say, I credit my quality acupuncture for both for slowing down its progression as well as keeping my symptoms in check. I no longer need medications with their many benefit side effects. I cannot emphasize how impactful this has been to the quality of my life. I echo the sentiments that the veteran who recently shared his story about finding permanent pain relief. High standards matter. I've always sought out highly trained individuals as education and proficiency are keys to its success. I'm profoundly concerned to learn that the educational requirements for acupuncture training may possibly be changed. California has a long, rich history for innovation and high standards in education. With respect to acupuncture, it was back in 1975 that Governor Jerry Brown recognized its importance and legalized it. Here we are 50 plus years later with the industry now at crossroads. I have found listening to the various speakers in today's session to be thoughtful and informative. While it is important to consider viewpoints from various concerned national organizations, I think that positions from members of the California Acupuncture Coalition should be weighted heavily in the decision-making process, as they are our primary gatekeepers to the acupuncture services. The proposed changes, such as adjusting the hours to acquire a degree based on cost factors alone, or to potentially allow other professions such as physical therapy who don't have the same level of training, neither of those benefit the patients here. There is no substitution for hands-on training or ongoing research, which add hours or are essential to the foundation for educating future acupuncturists and ensuring high-level quality care. Again, standards matter. It is now more important than ever for California to continue to maintain its position as a leader in education and professional standards, to be the gold standard for the nation. For that to happen, it is important to prioritize the interests of the key stakeholders in California. Let's not lower our standards. I respectfully ask you to support the recommendations of the California Acupuncture Coalition. Thank you.
Thank you.
And it looks like we have a final raised hand from AKA MAC. AKA MAC, you should be able to unmute yourself.
Hi, I'm Dr. Bonjour. I'm from ACAMEC President, Korean Association President. I'm Dr. Chung. I'm really support AB 2668. This is my opinion. We need doctors, all papers. We need everybody need not acupuncturist. We need doctors. Now we have a good time to upgrade education. Thank you, everybody.
Thank you, Dr. Boncho.
All right, this is a moderator. I see no further raised hands. I return the floor back to you.
Thank you, Moderator Tricia. So we need to take a 10 minutes break. Okay, so next item, the discussion and the possible adoption of standards of practice for telehealth services rulemaking, 16 CCR section 1399.452.1, including consideration of comments received during 15-day comment period for modified text. So Mr. Fang, please.
Actually, Mr. Budea will present.
Thank you, Mr. Fung. Yes, I will be reading out this. And then just before we progress into this item, we're going to do a real quick roll call, just since we'll be taking a vote on this possibly. So Dr. Yongping Chen?
Yes.
Thank you. Vice President Francisco Kim?
I'm here.
Dr. Shdong Li?
Here.
Member Leon?
Here.
Member Osorio? Thank you. We have quorum. So if you take to the materials packet, we have the telehealth regulatory package that we're bringing back to the board. We went ahead and provided a second comment period for 15 days to address the comment we accepted at the previous board meeting. And so I'll go ahead and go through the background here, provide this information to the board, and move from there. At its November 6th, 2025 meeting, the board reviewed public comments received as part of the initial 45-day public comment period that ran from July 4th, 2025 to August 18th, 2025. The board voted to reject the actions requested in the comments, accepted in part amendment suggested by comment number 4, and approve the proposed modified text for a 15-day public comment period. Staff noticed the modified text on December 5th, 2025, and the 15-day comment period ended on December 22nd, 2025. During that time, the board received one public comment which has been redacted to remove the personal email address and other identifying information of the commenter. Board is first asked to review the public comment and determine how it would like to respond to this comment. Once the response to the comment is determined, it is requested that the board direct staff to reject the action requested in the comment, make no further changes to the modified text, and continue the rulemaking process. Moving on to public comment and proposed response. Below is a summary of the comment the board received regarding the modified text during the 15-day public comment period, followed by the board staff's proposed response. The board may choose to adopt or modify the below proposed response or suggest an alternative response. Summary of the comment provided by Dr. Elizabeth Zelandia, Oriental Medicine doctor, licensed acupuncturist, was received on December 5th, 2025. The commenter states that the revised telehealth proposal does not improve upon the earlier version and argues that most acupuncture services cannot be delivered via telehealth. They assert that telehealth is limited to activities such as consultations regarding scheduling and emergencies, guidance on self-care, demonstrations of acupressure or exercises, and prescribing herbal or dietary supplements. The commenter emphasizes that hands-on treatments, including acupuncture, moxibustion, cupping, electrostimulation, massage, and acupressure, cannot be performed remotely and therefore should not be billable under telehealth. The commenter expresses strong opposition to the proposed regulation and believes it would negatively impact practitioners. The board staff's proposed response to this comment. The board has reviewed and considered the comments and declines to make any amendments to the proposed text based thereon. As stated in the initial statement of reasons at page 2, the board's intention for the proposed regulation is not to set out a separate, narrow list of each acupuncture service that is appropriate or not appropriate for telehealth setting. The intended approach is to allow an acupuncturist to determine from all the services listed in an acupuncturist scope of practice in Business and Professions Code section 4937 what is appropriate to offer in a telehealth setting. The proposal instead provides factors for a licensee to consider in determining what acupuncture services are appropriate and safe for telehealth delivery. Subsection B sets forth 5 different factors for a licensee to consider. Specifically, paragraph 4 of subsection B states in part that the licensee shall determine that delivery of acupuncture services via telehealth is appropriate after considering the nature of the acupuncture services to be provided, including anticipated benefits, risks, and constraints resulting from their delivery via telehealth. Allowing licensees to determine the services they can provide based on qualifying standards reflects the professionalism associated with licensure, while also ensuring consumer protection. It also provides flexibility for the licensee to tailor their services provided based on their ability and the needs of the patient. With respect to the commenter statement about what services can or cannot be billed under telehealth, the board notes that billing issues falls outside of the scope of this regulatory proposal. The modified text addresses services authorized by Business and Professions Code section 4937 and does not address billing, reimbursement, or coding practices. And Business and Professions Code section 4937 does not govern billing requirements. Because the regulation is limited to clarifying permissible telehealth practice for licensed acupuncturists, not payment or insurance matters, the commenter's billing-related concerns are not directly relevant to the proposed changes. For these reasons, no modifications to the regulatory text are being made in response to this comment. As such, the action staff is recommending to the board is to review the proposed response and consider whether to accept or reject the comment. After the review, the board may consider any of the following actions. Option 1, if the board members agree with the proposed response and choose not to modify the language, we would then say direct staff to reject the action requested in the comment, etc. However, if the board looks to make some amendments or modification to the proposed response, then we would have the next model language. I will now turn it over to the board. If you turn to the next page, actually, you will see the direct comment, if you wanted that as a reference. Are there any questions or comments from the board regarding this matter?
I'm okay with it.
No questions or comments from the board. Okay, do we have a motion on the table for either option 1 or option 2? It sounds like there's no comments and no modifications. Then I would recommend option 1, and I can read that.
Motion to adopt.
Was that sufficient for the motion?
Yes.
Okay, I will go ahead and read out the motion by Vice President Kim, seconded by Member Osorio. Motion is to direct staff to reject the action requested in the comment, approve the response to the comment as indicated in the meeting materials, authorize the executive officer to make any technical or non-substantive changes to the proposed regulations, and direct staff to take all steps necessary to complete the rulemaking process.
Actually, this is DCA Regulations Council, Stephen Vong. Can we do public comment before the motion vote too?
Certainly. We have now stated the motion, and we are opening it up to public comment.
Okay, now we open the public comments to this item. Any comments from the public in the room and over the website?
Nothing in the room?
All right, this is a moderator. I'm displaying instructions. If any member of the public would like to comment on agenda item 11, please raise your hand by clicking on the hand icon next to your name, or if you've called in, pressing star 3. We are displaying instructions and we'll give you a moment. I see no requests for comment. I return the floor back to you.
Thank you, moderator.
We'll take roll call vote. Motion on the table is as worded for option 1 to approve and move this package forward. Do we have Dr. Yongping Chen?
Yes.
Francisco Kim?
Yes.
Dr. Stong Li?
Yes.
Gregory Leal?
Yes.
Ruben Osorio?
Yes.
5-0, motion carries unanimously. Thank you. Thank you, Mr. Vong.
Next item, item 12, future agenda items.
I'll work with the board president, vice president. I imagine a number of the items we're tabling today, we will go ahead and hear it in the future board meeting. Any other agenda items from board members at this time? Yeah. Good.
So we have 2 bills we did not discuss in the board, AB 2668 and AB 2497. So I suggest to have next board meeting possible. If the bill is still there, we discuss.
Certainly, we'll bring the legislative report
Yeah.
there with any changes to any of those bills that we're tracking. And we will add the PT therapy bill or physical therapy bill.
2 bills. How about the public? Do you have anything in your mind you want to add to next meeting agenda?
Also, too, for the moderator and for the public, I'd like to note that we'll be doing 2 minutes for public comment going forward. And also, too, given the time frame of the day, we are asking that if the comment has already been stated as an earlier part of the day, you can just do a quick reiteration, or if you could skip it to allow us to finish our closed session items at a reasonable time, we would appreciate that.
Yeah. I would like to see next meeting. When would that be? Yeah. Do you have idea? No. Okay. So can I propose item is like that California, the acupuncture board understand that regarding that is related to the 266A, the bill is so important that we should also knowing the federal level and that how does the acupuncture go on in the federal level. And because now the school concerned about the student loan, about all this kind of things, and also that they should, we should be open to all the school, understand what's going on in the nationwide about the now it's a 1667 House Bill 1667. I will give you some more information later on. Thank you. It was for the 60,000. 60 million of the elderly, the Medicare coverage for acupuncture treatment is already in the system now, 2020. Now we just work on put the provider, like the qualified acupuncture into the bill.
Okay, thank you, Dr. Liao.
Any other comments on future agenda items from the room? Seeing none. Moderator?
All right, we have Dr. Yang or Lin Yang raising their hand. Lin, you should see a prompt to unmute yourself.
Hello, thank the board. This is a very helpful discussions, and it's good to hear the opinions from different parties and stakeholders. I'd like to propose the in the future agenda put how the acupuncture board, how the associations, how the schools, how the national organizations can work together and to provide our students in training, clinical training in the medical setting in the Western, in hospitals, in the major facilities. I think the whole industry needed to work on that. That could open the possibility for our students to be further integrated in the mainstream healthcare system, and the benefit is not for this profession, but for the patients in the hospitals and the major medical facilities. And that's what I'm proposing. Thank you so much.
Thank you, Dr. Yang.
All right, and we have a final raised hand from Lori. Lori, you should see a prompt to unmute yourself.
Would like the board on the future agenda to formally review whether California's current education to licensure pathway is protecting the public without unnecessarily constricting the future acupuncture workforce. Thank you.
Thank you.
This is a moderator. I see no further requests for comment.
Thank you, moderator.
So next item is the public comments for items not on the agenda.
As in the previous item, comments will be limited to 2 minutes and no repeat comments on the same individual. If you have a similar position to something that was already shared, just go ahead and quote that person and the position, please. Anybody in the room? Seeing none, let's turn to the WebEx room.
Thank you. If any member of the public would like to comment, make a comment on an item that was not on the agenda, please raise your hand by clicking on the hand icon next to your name. Or if you've called in, pressing *3. We are displaying instructions and we'll give you a moment. This is the moderator. I have not seen any requests for comment. I return the floor back to you.
Okay, thank you, Tricia. So next will be a closed session. Item 14, pursuant to Government Code, Section 11126, Sub A The board will meet in closed session for discussion, deliberation, and the possible action on evaluating the executive officer's performance. So this moment we'll come back. No more public, right? So the public probably is a time for you to relax.
Yeah, to be clear, we will be adjourning from closed session, so the board will just be going to the closed session and adjourning from there.
Okay.
This will be the end for the public. No additional comments opportunities.